Good afternoon. I'd like to call the meeting to order. First, we'll start off with the land acknowledgement. Good afternoon to our May 13th, 24 regular council meeting. The City of Belleville acknowledges we are meeting today on the traditional territory of many nations. The municipality operates on the unceded and unsurrendered lands of Indigenous peoples. We recognize and honor the historic relationship of the Indigenous peoples to this land and acknowledge our shared obligation to respect, honor, and sustain these lands and the natural resources contained within them. We recognize all First Nations, Métis, and Inuit who call Belleville their home and support the need for cultivating a strong relationship with them. We look forward to fostering a path toward reconciliation and show respect for the Indigenous people who first lived and currently live on the land where we now all reside together. I'll call this meeting to order. We are all present except Councillor Chatton, and a moment of reflection with City Clerk Matt McDonald.
May we be worthy custodians of all that has been entrusted to us. Help us to be concerned only for what will promote good government. May we bring to our council chamber minds that think and hearts that feel, always having respect for others so that
Need a motion for confirmation of minutes of the regular council meeting minutes of April 15th, 24, the special council meeting minutes of April 9th, 24, regular in-camera meeting minutes of April 15th, 24, and the special in-camera meeting minutes of April 19th, 24. Moved by Councillor Thompson, seconded by Councillor Wright Miller. Questions? Councillor Thompson? Sorry, pardon me?
On a point of disclosure of pecuniary interest.
Oh, okay, so we'll move back to that, I guess, yeah. We'll do the minutes. All in favor of the minutes? Disclosure of pecuniary interest, general nature thereof. Councillor Thompson?
8B3, Grant 514. I sit on the Enrichment Center Board of Directors.
Thank you for that, Councillor Thompson. Deputations, we will start with Fire Chief Smith. The Chief is here. Oh, there you're hiding over there. So come on up to the podium, Chief. We have, we'll present service medals to members of the Belleville Fire Department.
Thank you, Mayor and Council. I'm going to invite our two deputies, Mark Shannon and Jim Young, up as well. So this evening we have some federal and provincial medals that we'll be presenting to members of our department. This year we've got some 20-year medals, which are the federal medals, and then we've got one 25-year provincial medal, as well as one spouse recipient this year as well. So first we're going to call up firefighter Kevin Fisher. This evening Kevin will be receiving his 20-year federal medal. Next up, we have Captain Jason Vai, and he'll be receiving his federal 20-year medal. And next, we're going to bring up someone from the past. So we have a retiree that's come back to receive his medal. We have firefighter Ed Kooning, who's going to be coming up for his federal 20-year medal. And for the next recipient, stealing the show because there's 3 things that are be handing out tonight for the Parks family. So Captain Steve Parks is going to come up and receive his 20-year medal, his 25-year medal, and his spouse Sarah is going to come up and receive a pin as well. So spouses receive something after 25 years of service for their spouse. We kind of normally look at that as you've put up with us for 25 years. We're going to give you something in return for that. And I don't think she knew she was coming up.
Thank you.
So that is all of our recipients for this evening. We do have a number of other firefighters that are receiving them. Some have decided they'd like to receive theirs amongst their peers back in the station, so we'll be presenting those while firefighters are on shift. As the rest of the team here probably will vacate the room, not that they don't want to stay, but I don't think they really want to stay for the whole show tonight. I did want to point out 2 more people tonight. So I'm just a little over 1 year here. This isn't on the agenda here, but I want to say thank you to the 2 deputies. So Jim Young and Mark Shannon. They've had my back, and it's been a huge success for us over the last year. So I just want to say thank you to those 2 guys as well.
I need a motion to receive the medal presentation. Moved by Councilor Brown, seconded by Councilor Millette. All in favor? Carried. Next, we have Girl Guide certificate presentation. Please. But okay, please join me in welcoming Morgan Curie and Isabel Mercier and their guider Allison Taylor to today's council meeting. Morgan and Isabel are Pathfinders with the Girl Guides who have recently been awarded the Canadian Accord Award. This is the highest award that can be earned in the guiding program. The Pathfinders that achieve it have accomplished skills in the areas of camping, citizenship, life skills, arts, and community service. On behalf of the City Council and the residents of Belleville, I'd like to sincerely congratulate you on your achievement. Now, are you in the audience, I guess? We gotta get you up here. Come on up to the podium. Oh, we're over here, sorry. On your achievement, it is encouraging to see such dedication and commitment from such a young age. I'd like to present each of you with a certificate from the City and Council on your great achievement. So let's tell a story. How are you doing? So was it hard to get all those awards?
It was okay.
3 years?
But you guys have been in guiding since you were little. 5 years old.
5 year old.
You guys started as Sparks and worked right up to Pathfinders.
My daughters went through that also. Yeah. What do you think of the council chambers? Look pretty cool.
Sure.
Say in the picture and take a picture while we're away.
No. I'm
Good run me. Probably did a better job.
No.
Here, oh, like- oh, yeah, okay. Okay, Isabel. also to Morgan. And Morgan, congratulations. We'll have it here, and we'll get your picture for the social media. Okay. Thank you. All the best. Need a motion for that to be received. Councillor Enright Miller, Councillor Carr, all in favor, carried. Next, we have Dr. Ethan Tumasay of Hastings Prince Edward Public Health to make a deputation to council.
Thank you. Hello. Thank you very much for having me. My name is Dr. Ethan Tumashay. I'm the Medical Officer of Health and CEO of Hastings Prince Edward Public Health. Before I begin, I just want to acknowledge the work of our board members who are sitting at council right now, between Councillor Thompson and Councillor Kelly. Particularly, this update is focusing on potential mergers within local public health, and Councillor Kelly has been a part of our team that's locally been representing the area, and that's been a significant undertaking. So I want to do additional thank you just for all the work that you've been doing as a part of that. So I want to give a presentation. It's going to be high level over this initiative. So as we're going through, please stop at any time for questions because there'll be multiple components. What we'll be focusing in on is what has been progress to date on the exploration of merger and how we're moving ahead. So that's going through the overview. Want to look at the public health strengthening. This is a provincial initiative altogether. Look at work that has been done and what we're seeing as the next steps in the coming little while. So this was announced last August, but Strengthening Public Health is a provincial initiative that was looking at three things in the public health space in Ontario. That's a redefining of roles and responsibility. Practically for us, that looks into what we call our standards that defines the work that local public health agencies do. That work has been ongoing, but this is a longer timeline when you're looking at that program by program aspect of review, but that is ongoing work. A second component was a voluntary mergers, and a critical piece of history is that pre-pandemic there had been another initiative that had been put out. This was the modernization initiative by the province that had very different language and focus. I'd say this was going to take at the time 34 health units going down to 10 within the region with a focus on efficiency, cost savings within the system. What has been announced within the Strengthening Public Health is, especially after the experience of going through the pandemic, as well as all the other aspects of public health that we've been responding to over the years, is looking at how to increase capacity and system robustness within the public health space. So we'll go over the voluntary mergers component in greater detail. A third aspect of this Strengthening Public Health review is the funding. There are multiple components of that. One was a reversal of some changes that had been proposed during the modernization initiative. Currently, we're in a period with very defined funding. We know that's 1% per year for 3 years from a base budget perspective for public health. And that there is a next step to this that we don't have further details. As we understand, there's going to be a review of the funding formula overall within public health, but that's something that'd be upcoming with more details and engagement from the province. So the desired outcomes that were put out by the province, again, this is announced going back into August, was looking that local public health agencies have the critical mass and capacity, that they're optimizing performance, they can meet unexpected surges in demands. So looking at where there has been demand going through a pandemic, MPOX, the effect of poison drug supply on our communities, all these various things that we've experienced over the past few years. A critical focus here is particularly of those skilled personnel and competencies so that you can have fully delivered services that would be matching across organizations. As it currently stands in Ontario, you can have a very wide variability on the size of health unit and the resources that would be available between what we see at Toronto Public Health, many thousand employees, looking at what we have currently with Hastings Prince Edward Public Health. And where that is particular focus, I'll use this as being an example, is that we have many skilled employees where we may have a singular individual, such as our epidemiologists. And that's a skill set that allows us, people may be familiar with the dashboards that we are able to push out information through the pandemic. That's a increasing demand of that information transfer and interaction with the public. So that's a skill set that is in demand and need, and would be representative of that skilled workforce and trying to create a more robustness and system capacity. And then we also see that we're focused on alignment with other changes that be happening, or system partnerships, which we already work closely with, but when we look at health system partners, such as continued development, so Ontario Health Teams, when we look for educational partners, so that being a primary focus of this as well. So of those being the desired outcomes, there were particular objectives that were announced. One of the critical things is that this is looking for smaller health units to, through voluntary mergers, that you're going to have an increased capacity. But that was looking to serve a minimum population of 500,000, and then detailing through through a business case that was submitted to the province, how you're achieving improved organizational performance, that you have sustained and robust leadership structures where you can have increased capacity with responding to calls and or on-call structures as being, for an example, that sustain competencies and capacities for those specialized role, which there might be a variety operating local public health. And then you have that supporting alignment with partners and within the communities and our priority populations. Critical aspect of the Strengthening Public Health Initiative was that there was established a 3-year merger transition fund that's going to support these costs. This would not be an exhaustive list of what was on the table to support the process, and this is a process with costs and requirement for investments, but consulting services that have utilized, and we'll get to that, but have utilized in order to start with this planning process. Things such as wage harmonization would occur when you're bringing the organizations together, and temporary FTEs that could support. This would be not a fully exhaustive list, but that there is funding support by the province in order to engage in this process. So we engaged in terms of the feasibility, and then requesting through a business case of what would be the funding that would be needed to support local public health going through this particular 3-year process, in particular in a way that's not going to create increased burden on our municipalities, which has also been a stated objective by the province in engaging this. So very quickly running down with the work to date, but there was lots of engagement within smaller health units in the province. Quickly identified that within the southeast we have health units for which we have a number of shared history, shared programs that we deliver. We also have shared partnerships, whether that's sharing school boards, academic medical centers that we'd be interacting with, educational partners beyond, such as colleges that we would both be interacting with. So we look to Kingston, or Frontenac, Lennox, and Addington Public Health, Leeds, Grenville, Lanark District Public Health. These were identified as very keen partners to engage and explore a potential merger with Hastings Prince Edward Public Health. There was a tri-board structure that was initialized to do that exploration, and then contracting through a consulting firm, Sense and New, that had extensive experience with local public health in Ontario, but also particularly mergers of local public health as they've been engaged in some of the recent ones that had occurred within the last 20 years in the province. There were particular deadlines that we were racing to meet. Particularly, there was that if mergers would be going ahead, there was a deadline of August 2nd for putting in a business, or April 2nd for putting in a business case associated with that. And there was funding associated with exploring that feasibility. This work was completed through the work of all the partners, from team members, from all our board partners with these meetings as well. And a feasibility assessment was accepted, and that business case was submitted, all with meeting in the deadlines. You'll see the approval times here, but the short of it is that we had a very quick turnaround for this sort of work. But recognizing that within the region, within the work, we see the increasing demands and how we can achieve better. Because at the bare minimum, if we're going to engage in a voluntary merger process, that has to be the outcome, that better can be achieved and will be achieved with serving our communities. We did that work and have submitted the business case thus far. Sorry, now getting to where we had announcements, and that has been, I understand there has been updates provided periodically as well. But it gets us to where we're at now. We have this business case that's submitted. We've had some preliminary discussions with the province on that business case. These have been very productive. This is a very collaborative relationship that we've had thus far with the Ministry of Health off of this, and a shared vision when we look to that system capacity that would be necessary for public health to keep responding to the threats that we may encounter in the community in the future. So that work is ongoing. We have the structure of this Southeast Transition Team currently, as the Tri Board has completed its work now into, and what would be proposed for the new health unit is the Southeast Health Unit. So the Southeast Transitional Team is continuing to meet and work to push that ahead. We are not out of the short timelines. As what's been proposed is that for a merger to take place, this will be starting with the new organization as of January 1st, 2025. So we're keeping the work and momentum going now, but it's been a lot of work on all parties with this vision of how we can increase the capacity that's being delivered for local public health in the province. And there are these stated goals that from the province they put out, is that this is not supposed to be affecting frontline services. Any efficiencies that are found are intended to be reinvested at the local level. And that's a shared goal that we see between all the health units sitting at the table as well. So it's the opportunity to engage in this work, to increase the system capacity where it's supported through that investment as we're going through the transition. So that was a very quick and high-level overview, looking into an update. If there are any questions, and to keep coming for updates as we're going to.
Councillor Thompson?
Thank you, Doctor, for coming in. It's a pleasure to sit on the Health Board along with my cohort, Councillor Kelly. I think it's important that we let the people know that there's no cost to the taxpayers, even though there's only one taxpayer, provincial or federal or local. There's not going to be any cost to local taxpayers on this transition.
Yeah, it is a supported process so the merger transition funding is intended that you're not going to have an increased burden on the local taxpayer, and there has been money that's been set aside with this being a priority to fund that. For context of how many other places may be engaging in this, we're not the only ones that responded to the call. So Peterborough and Haliburton, Kawartha, Pine Ridge Public Health are also moving ahead. Temiskaming, Porcupine, so that's Timmins area, are moving ahead with the merger, and also Haldimand, Norfolk, and Brant County are moving ahead with this. So there are others, but a smaller number that would be moving ahead with this process, and it is a funded and supported process by the province.
And my second question is, the programs that you provide here in Hastings County and the Health Board here, none of those programs will be affected through this merger? Because there's some great programs that you provide through the Health Board, so it's important that we're not going to lose any of these important programs that you do and possibly enhance some of them. So what's your feelings on that?
Well, I thank you for the question. To go back, I think the whole point of going ahead with this is for better service and better delivery. As the baseline, it's that this is not supposed to be affected within the frontline programs or how those are delivered. And we do expect some changes. We're going through a standard review just on how that work is defined, but this is an opportunity to look to see how we can reinvest at the local level, how we can find some efficiencies, work together, and to improve services. So I'm optimistic based off of everything on all the work we've done so far.
Thank you.
Councillor Millat?
Thank you, Your Worship. Through you to Dr. Tamishi. Thank you for coming today. I just have a couple of brief questions, and you'll have to forgive me if I'm not mildly skeptical when the province asks for amalgamations and things of that sort, because any of us who've been around in the 90s and saw the last amalgamations, this is how we ended up with some of the amalgamated municipalities. Some worked out better than others. But you mentioned that some of these amalgamations took place in other areas. Are there areas of the province that aren't working cooperatively to in the manner that we saw, and with Councillor Kelly's involvement and the rest, or is this happening all throughout the province?
I don't think I can fully comment on conduct or intent between for the other health units. As stated, there are other health units that are moving ahead. This was a general call for health units, again, that were smaller in size. There are a number of large health units for whom this wouldn't apply. But to go back, I think that from the work that's been locally here, the stated intention from the group has been to be a model for this province and how it can be delivered with the full cooperation of local partners and with that shared goal. So that's the goal that we're putting for ourselves. I also think that the other partners that have moved ahead with this can see that too, because we did have to meet very short timelines. So it was a lot to move, and when you can see that other health units are moving ahead with this, they can also see positives for their communities.
Yeah, and I thank you, Doctor. And the timeline was, from where I sit, alarmingly short, but I can comment on that from where I sit, because I thought it was a little hasty in some of the timelines set. But congratulations on achieving that. My question, my follow-up questions are, bricks and mortar, we now have we just recently in the last several years, built the North Park Street facility that we now know of. Any changes there, and do we know whether or if there will be any effects on employees? Will there be layoffs? I mean, or reductions in staff? Whenever I hear efficiencies, again, pardon me for being skeptical, but that sometimes means, yeah.
No, and fully appreciate the questions too. Can be when we're looking at the footprint, the intent is not to change and the footprint of where I say that the buildings where it's being served, and those are where the populations are, and the service delivery is being coordinated. So there will still be the work of public health has to go out, provide vaccination clinics. They're doing that, so that be intended. Being more specific on the language, our base budgets are not changing through this, as the base budgets, they're relating to FTEs and for the number of people that would be involved there. So I don't expect that this is going to create a significant job reduction, and stated we're looking for how this can invest in local public health, as we've really seen that change of language that I think speaks to the experience we've all had over the last few years. So if that when we look for community safety from being prepared, pandemic preparedness as being, for an example, it underscores the work of local public health. So I think there is a lot of that experience that has changed the language for when we were seeing modernization being proposed before.
Well, good. And I certainly don't want to discount the benefits of the shared experience of the professionals in the other health units, and now, you know, that collaborative effort working towards a greater good going forward. So I wish you all the luck with it, and thanks very much for your presentation.
Councillor Kelly?
Thank you, through you, Chair. Just a couple things. I'll get to my question real quick. I've had the chance to work with Dr. Toubache and the team for the transition with Kingston, Frontenac, and Leeds, Grenville. We're going from 171,000 in Hastings County up to over 500,000. The province put this on the table for municipalities. Right now there's 34 public health offices across Ontario. They want to put that down to 10, and Dr. Kieran Moore is the Chief Medical Officer of Ontario, spoke to the committee about a month ago and championed the work that has happened with this transition team as being very positive. The question that I get when the talk of the merger was going to happen, Doctor, was How is it going to look for chief medical officers with the 3 regions? There was some concern that maybe Belleville would lose some of its political pull or medical pull at the top level, and also just any of the services that could be lost, because the city of Belleville contributes $1.2 million to public health budget. So just let you go from there. Thank you.
Thank you, Councillor Kelly. A few things to speak to. I'll just try and frame or parse it out with it. Particularly looking to the service and that medical expertise, and this is just also speaking to my colleagues from the medical leadership of the other 3 health units, and this extends across the senior leaders within the boards. It's a very collegial environment. We're working on those models as providing the medical leadership and medical access, as we have roles that would both be providing senior leadership to the organization, but also providing direct service as well. And a key thing that has been heard through this process is that areas do not want to lose that or any particular service, but that being an aspect. So that's heard loud and clear, and looking at now we are not at the point where we've got finalized models and work, and we'll be coming to share with as we get those details and get that work done, but prioritizing that we're keeping service, that we're keeping access to that service within the local, so that you can have that both from how we're delivering local services, such as our clinics, sexual health clinics, immunization clinics, but also coordination with community partners as well. So that's a priority. I apologize. Did I answer all? Okay. Thanks.
Thank you, Mayor. Thank you, Dr. Timoshay, for coming. I have 2 questions. You talk about efficiencies and reinvesting into the front line. Is there an identifier as to what that is monetarily, and how do you see that? Because if there's no real change in your FTEs, where are those savings being achieved, and how are they being reinvested? And then with that, can you describe in your one slide, I think slide 4, you talk about optimizing performance. Can you describe what that means in terms of actually service provided to the results you hope to achieve with the reinvestment in frontline? I know it's kind of convoluted, but the money follows the service provides the result, and generally speaking, you say that this is all going to get better. So I'm kind of looking at the drill down as to the monetary savings that will be reinvested into the front line, and then what results do you hope to achieve through optimized performance?
Absolutely. And I'll jump to the end. If there's a lot of work when we're getting into some of these, how the whole thing is going to look at the end to do with it. But so I don't have final numbers, but I can get some very specific examples of what I'd be looking at. So one might be the suite of products that support the business that we're currently purchasing and agreeing in triplicate. When we look to various IT systems that we'd be engaging with, things that are supporting our corporate functions. So those would be opportunities. We also see an opportunity of specialization. So this is more in the functions. At the size of organization that we're at, a lot of people would have to have multiple hats on. So you can have some, and we've talked very specifically with our consultants, those are some of the efficiencies that you do see because you can start to specialize in those functions. And I'll give the example again of an epidemiologist, but this may extend across. When you're the only person with your skill set in the organization, you have to respond to every aspect that would require your skill set. When you have the team, you can have, say if you're now joining a team of 5, you can have more skill specialization that can improve that productivity. So that would be just from how we're able to deliver better. There may be coordinations too. We offer a lot of programs that are based off of geographies, so where which teams are going to, say which schools are conducting inspections here. So there's a lot of that work where I think there might be better coordination. So it's work that is to be done. The focus when we're getting to those program levels, this is going to be a multi-year process. The first steps are going to be some of the corporate priorities when we're bringing the organizations together so that it's still operating as people expect from a front line of how services are running. and from our employees, that staff members, that things are operating as they should, people are getting paid. So those are going to be very immediate priorities for the planning phase. So it'll be early to provide more concrete numbers, but those are some of the ways that we can see in how we're operating now, that when we're going to a larger system and we're having more robust teams, we could have better service delivery, specialization within roles, the greater ability to build more skill sets and deliver products such as you see at larger health units. There may be efficiencies in how direct service delivery is being done now, but it's early to dig into those details.
So, I don't want to belabor this, but it sounds as though the efficiencies are somewhat speculation in terms of what you hope to achieve. It sounds like there's some back office synergies that can occur. But in terms of what do you anticipate in terms of your, we see all the time, for example, students fall behind in their immunization. And so that's a big push every year. We see it every year. Do you hope that through this realignment that the actual healthcare delivery, the tip of the spear, if you will, on healthcare is actually being increased in terms of performance? I guess that's the end. The back office synergies certainly help with some of that, but do you see a reinvestment where you can say that your restaurant inspections will increase, your things related to youth and smoking and inspecting stores that are selling cigarettes to underage children, and some of your other health programs? Do you hope to see better delivery and then kind of have an idea of what that would look like in terms of better health outcomes across the region, if I could ask that?
So in short, yes, I can see that. There might be a variety of ways. There might be better systems with more efficient economies of scale that can support that direct work. More efficiencies in some of the other things that we do we can redirect with those resources. As it currently stands within prioritization is something we have to do for how we're delivering those services within the standards. So there might be a variety of ways that we're looking at how that from both those direct activities such as immunizations, inspections. We also engage in a lot of health promotional activities, looking at campaigns that be speaking to trying to prevent with smoking as being, for an example, and we can see how that economy of scale might be able to benefit when we're planning that for a larger region.
Motion to receive. Thank you, Doctor. Also, Councillor Ostap, Councillor Brown, all in favor? Carried. Thank you for the excellent presentation.
Thank you.
Been a family doctor here in Belleville for about 15 years. Actually, the last time I was in this building was when I signed on with the physician recruitment program in January 2008 when Mayor Ellis was also the mayor. So, so it's strange to be back here. But a few colleagues and I are here today to talk to you all about the family medicine crisis, not only in Belleville, but in Ontario as a whole. And obviously we all know that healthcare is a provincial issue, but the province are not listening to us. So we're here to see if the city can help us because we are in true crisis mode. So what I'm going to talk about today, and then some of my colleagues will step in too, is we're going to talk about why we're in crisis. So the chronic underfunding of family medicine in Ontario over probably the last 30 years or so by successive governments. What are the consequences of this for patients in the healthcare system? What other provinces are doing to help the problem? And we're going to ask the city for help because, as I said, our province is not listening to our calls for help. So as family doctors, we're the backbone of the healthcare system. We're also small business owners, which a lot of the public don't seem to realize. They seem to think that the government pays for everything in our office, whereas it's all out of our own costs. We also know that having a long-term family physician will decrease emergent hospital admissions for patients by up to 30%, pick up cancer early, make them live with chronic diseases like better, and it's very soul-destroying to be a family doctor in Ontario and have unattached patients call our office, send us letters every day of the week begging to be our patients, promising they'll be good patients, but we're all at such capacity that we can't take on any more patients. For us as small business owners, we are not able to increase our fees to offset the cost of living that's gone up exponentially in the province, in the world. Those fees are set by the Ministry of Health, and despite our Ontario Medical Association negotiating, we can never reach a reasonable increase in fees, which affect us as doctors, but also patients at the end of the day. And to be honest, it's becoming an unsustainable business model, and that's why we're in such crisis mode too, because so many young graduates are not picking family medicine as a career. Those of us who have chosen it as a career, a lot of doctors are closing their offices because they literally cannot afford to keep them open. So these are some interesting stats. So 52% of all medical services in Canada are provided by family doctors, but we're only allocated 5.7% of the healthcare budget. So that's, I think that's a pretty startling statistic. The stats at the moment in Ontario are that currently there's 2.2 million Ontarians who do not have a family doctor, and that's only going to increase to about 3 million in the next 2 years, which is 1 in 5 Ontarians. Despite what Sylvia Jones said last week, saying that we do not have a problem with doctors or doctor recruitment or retention in Ontario, these are the true facts. 47% of all doctors, whether that be family doctors or specialists, are planning on leaving the profession within the next 5 years, and that is not for retirement, that's just closing up shop and using their skill set somewhere else. 40% of family doctors polled by our Ontario Medical Association state that they plan on retiring in the next 5 years. I know in our small town there's about 3 long-standing family doctors who are planning to retire, and the ricochet effect that has on our offices is huge, because all of those desperate people start calling, sending us letters, tying up our phone system so our patients can't call, and I can't read people's letters anymore, to be honest, because they break my heart. And we do send them all up to MPP Todd Smith's office, but unfortunately I'm not sure how many go up there, but I have personally reached out to MPP Todd Smith through email talking about this crisis and have never received a reply. He was invited to the meeting I had with Mayor Ellis and Karen Post, and unfortunately he didn't show up. So we feel like our voices are not being heard at the province level, so we realize it's not a municipal problem, but we're asking for help. The other startling statistic is that fewer and fewer medical students are choosing a career in family medicine. It used to be about 39% of graduating medical students from every medical school across Canada would choose to be a family doctor, but that number in recent years has dropped to 30%. And a lot of family doctors are burning out because we do a lot of unpaid administrative work, which takes away from our time seeing patients, which makes our wait times longer for patients to see us, and which leads to not only doctor satisfaction but patient dissatisfaction, but patient dissatisfaction too. So there's many different funding models for family doctors in Ontario. I thought I'd just kind of focus on the basic one, where we get paid on average $38 for a visit. So a patient comes to see their family doctor. If they see them for 1 reason, 3 reasons, 5 reasons, we get paid $38 to see them. And out of that $38, we have to run our office, and that includes paying for staff, paying for rent, paying for utilities. I don't need to belabor the point, but $38 isn't going to cut it. And our Ontario Medical Association always sets what our fair market fees should be, and they say that on average for such a visit we should be getting close to $100. So really we're subsidizing $60 of that, and unlike other small business owners where they can increase their fees and rates to manage these higher costs, we are bound by law that we cannot. We're bound by the Ministry of Health fee schedule. We're also not allowed to strike as doctors. So what happens with this chronic defunding? We can afford less and less staff to do all of the tasks that are necessary in a family doctor's office. So less people to answer the phones, less nurses to do the nursing care that we need, less staff to manage all of the constant faxes from pharmacies, dealing with specialist issues. And so this then leads to increased waiting times to see the family doctor, which leads to worse illness outcomes. People will go for non-emergency care to our local emergency departments, which we hear in the news all of the time. This increases wait times at the emergency departments. And really, I think the bottom line for an emerge visit, a basic emerge visit, it's about $350 to OHIP. And whereas we, again, are about $38. So it's a substantial difference in cost to the healthcare system. So as I said, I've been a family doctor in Belleville for 15 years, and this kind of shows how inflation has gone up, how our fees have gone up, but the two are obviously not meeting. And we're down probably around 34% in income over those 15 years, and actually about 20% over the past 4 years alone because of the cost of living. This is another quick graph which shows that net income, we've had a reduction in net income over the past 10 or 12 years of about 28%. As I've mentioned before, nobody is choosing family medicine. This shows Ontario medical schools and the unfilled family medicine residency positions in the first round of what we call the match every year. And Queen's is the orange one. And you can see that every year these numbers are going up and up and up in the unfilled positions. We ended up filling all of the positions in Queen's this year, more so with internationally trained doctors, because Canadian graduates are not picking family medicine as a career choice. So why? Why are they not picking it? Because their tuition has gone up exponentially, and they're coming out with massive amounts of debt from medical school, often in the ballpark of 200,000 to 300,000. And then if they need to set up a family medicine office, they need a small business loan, they need to hire staff. And it's essentially, the bottom line is they can't afford to be a family doctor in the current world we live in. And of those that do choose family medicine, very few of them do purely office-based practice. So the traditional family doctor who's in their office seeing their patients for decades on end is changing, because a lot of family doctors will work in other parts of the healthcare system, which is very important. We need family doctors in every part of the healthcare system, but they work in other parts of the healthcare system where they do not pay overhead, and that supplements their overhead costs in their office. So if family doctors are working in the hospital, working in Emerge, they've less time to spend with their patients in their office, and so they don't tend to have as big a practice as, say, some of our retiring family doctors would have, just because there's not enough hours in the day. So we have had a residency program here in Belleville, part of the Queen's Family Medicine program, since 2010, and I've actually been involved with it since the beginning. So in 2010, we started the program with 4 residents. So residents are doctors who finish medical school and now they're in their specialty training. And for family medicine, it's 2 years that they train after medical school. We went up to 6 residents after 2011, up until last year, where we're now taking 8 residents per year. Now, I looked at the stats and I realized I did some of the math wrong, so don't hold it against me when I looked at it again, but we've graduated 70 family physicians in the past 14 years from our Belleville site alone. And of those, 67% have a family practice. And a lot of those also work in other areas of the healthcare system too. The statistic that was most startling to me is, of the 70 that we've graduated, 5 have already quit family medicine. Like, that's a startling statistic for these young doctors. And they've quit altogether, walked away from family medicine, either through burnout or through unattainable costs. And then the rest of the doctors we've graduated work in, again, hospitals Emerge, and do not have an office. So other provinces have been listening and have made some changes. And interestingly, I read a statistic that Ontario has spent the least amount of money on healthcare per capita, over every other province in Canada in the past few years, despite being the most populous province. So in British Columbia last year, they developed this model called the Longitudinal Family Practice Model. They introduced it in February 2023, and essentially in this model, doctors are paid for the time they spend with each patient, and they're also paid for all of that indirect care that we do. So all of the administrative tasks, which usually fall on our own time and that are unpaid. And interestingly, by the end of 2023, they'd increased family doctors in British Columbia who work in their office by 16.5%. So you can think of how many thousands and thousands of British Columbians are now attached to a family doctor that weren't before that model came into play. We've seen similar things happen in Manitoba, where they also do an add-on code to each visit to help increase or offset increasing overhead costs. And in Nova Scotia, they've increased fees across the board, and they also provide locum support. And we'll talk a little bit about this later on, but when we take vacation, which we absolutely need to as doctors in order to sustain our ability to practice medicine, it's hard to leave your patients stranded when you go away on vacation. So a lot of us will pay for a locum doctor to cover for us while still paying our staff costs or overhead costs. So it kind of tacks on like double the amount of your vacation to pay for a doctor to cover you. Nova Scotia have also looked at providing parental leave for doctors, which is very helpful. And then what is Ontario doing? Not enough is the bottom line. Ontario have been looking at short-term solutions that cost less money rather than long-term solutions. And so they have been trying to focus on other healthcare providers like nurse practitioners and pharmacists and give them more scope of practice. And to give you some perspective, as family doctors, we do not have a pension, we do not have benefits. Whereas NPs are salaried, they don't pay any overhead, they get pensions and benefits. And they have a loophole through the Canada Healthcare Act or Medicare where they are not paid by OHIP, or they do not bill OHIP. So some of them are setting up private clinics across Ontario and charging patients triple the amount of what a family doctor earns for the same visit. And patients are desperate enough that they will pay the money because they have no other option. And I'm not saying anything bad about nurse practitioners. There's an absolute role for them in our healthcare system, but they are not equivalent to us in our hours of training. And we do know that on paper they can cost the healthcare system more money because they order more tests and refer to more specialists than we would. The other thing, which I'm sure you've seen in the media, are pharmacists are getting paid $75 by OHIP to do a medication review for anybody who's on more than 3 medications. And we as family doctors get paid $0 for this despite doing it in every visit. So it's just further demoralization for us. And the government will state that they're investing in teams, and we have some members of our local Ontario Health team here today to talk as well. And unfortunately, none of that team-based funding is coming to our area. And lastly, Mr. Ford has decided to open a new medical school in York University, which is fantastic, but if nobody's choosing family medicine, it doesn't really solve our crisis that we have. So what should be done? I mean, this is more at the province level. British Columbia has shown that if they pay doctors appropriately, doctors will work. Doctors will come and work in offices and they will take patients and follow them. And interestingly, for every $1 invested in family doctors, it saves the healthcare system $13. So long term, be great. I'm going to hand over to my colleague, Dr. Carter, who's going to talk to you guys about what maybe the city can help with, and some of my other colleagues will talk to. And thank you for your time today.
So yes, I'm Casey Carter. I'm a family doc here. Also own a medical clinic building just down the street on Front Street here. Been working as a family doc for about 3 years now, and signed on to the city 2019, I believe, back in the day. Basically, you know, Dr. Whalen has gone through all of the information in terms of the province. Because the province isn't listening, we're hoping you can advocate for us, but we're also hoping you can help in terms of just recruitment, which, you know, has been great for the city, but we need retention. We have family docs who are working here who are closing up their practices and they could have been working for years and years more. We need the city to try focusing on retention just as much as recruitment or more. When we had our meeting with the mayor and Karen post, we were kind of asked to figure out what other areas are doing in terms of retention. Interestingly, Kingston had shared a draft proposal that they're working on for clinics that have been working for over 2 years and have asked that they will increase their patient roster by about 1,000 to 1,200 patients. They're giving the ability for a $100,000 grant to the clinics to help with that increased patient load. Newfoundland had a bonus for family docs working in full-time practices of $25,000. Manitoba had a system where every 5 years that you work, you get a bonus to help keep people going. Peterborough also has a $5,000 per year grant that they are suggesting. There's a Norwood, a small town that actually has a clinic building funded through the city where the staff for the family doctors is also allowed to be salaried through the city, given benefits, pension through the city, overhead is covered. So there's a lot of areas there. We have our fellow colleagues who are going to go through in more detail as well, but even just from being a clinic building owner myself, like I try to keep the rent as low as we can because it's all just coming out of our pay, our budgets. But even the city, like the city taxes on my medical building, $1,600 a month. We don't have $1,600 a month to just pay for taxes for the city that we're trying to serve and help the patients. So we'll go through some more options as well.
Hi there, my name's Sam Greatson. I graduated from the Queen's Residency Program about 5 years ago and opened my practice here in Belleville about 4.5 years ago. And just want to touch very briefly on a couple of ways that the City of Belleville can support retention of family doctors in the area. I think it's important to recognize that doctors who are trained in family medicine have a choice in their careers between opening and maintaining a family practice and a variety of other ways that we can use our skills, including working in the emerge, the hospital, long-term care, in the operating room, and that a lot of those alternative options carry far less administrative burden and far less overhead cost. So if we want to retain family doctors who are trained and actually keeping them doing comprehensive primary care here in Belleville, I think that the city could try to make having a practice a more feasible and viable model. Right now, doctors like me who are choosing to keep our practices open are doing so because we know this type of medicine is really important to us. We know it's valuable, we know it provides good patient care, and that it is really important to our local community. But we want this type of family medicine to be as sustainable and viable an option for us in our careers as a variety of other things that we can do. And I think anything that the city can do to incentivize doctors having practices in Belleville that other places don't have is going to sort of tip the scales towards people opening practices, keeping their practices, and doing it here rather than taking the skill set elsewhere. Two big categories that I want to touch on briefly. One is assistance with the cost of overhead, and two is assistance with locums. In terms of assistance with the cost of overhead, simple idea would just be to have subsidies or grants that eligible practicing family physicians could use towards the many costs of opening our offices. That means rent, that means paying our admin teams and our nurses, that means our utilities, our software fees. Anything that could be done to offload those costs will make this a more sustainable career option going forward. I also think a model where the city owns a clinic building and rents that out to doctors at a subsidized rate will also be another version where cost cutting would make being here compared to a place that has more expensive rent more sustainable in the long term. In terms of locum coverage, as Dr. Whelan had already alluded to, it's very hard for family doctors to take any time away from their practice. Our patients are our responsibilities, whether we're there or not. That means vacations, but that also means things like parental leaves. That also means things like leaves due to medical illness. When you have to be out of the office, you have to pay someone, often coming in from out of town, to be able to cover your patients when you're away. That's costly, and it's also, there's a really small pool of people to pick from, and often you're bringing them in from out of town. I think things that the city could do to help with that. One, if there was accommodations for locums to stay in the city. Other places do this. It means that they have somewhere when they're coming in from out of town to stay that is not an additional cost to them. And any sort of financial support for the salary of the locum while they're working here, particularly for things like parental leaves and medical illness leaves, means that people who might otherwise have to close their practice because they have to be away for a prolonged period can come back to their practice when they're well enough to do so. I'll turn it over to Dr. Brown.
Hi there, my name's Kara Brown. I'm another one of the family doctors in town. I've been working as a family doctor since 2012. And one of the other suggestions that I wanted to broach you with was the idea of some sort of pension or benefit system to help support the family doctors who are continuing to stay in practice here and serve the population in Belleville. So just to clarify, family doctors or physicians in general are the only government workers who do not have access to things like pension and benefits. And it was intended at the time when we were allowed to incorporate that that would be in lieu of any raise in pay, any fee structure raise. And because of the changes to the corporation structure, as I'm sure you're all well aware, any ability to save for retirement, the new tax changes with capital gains, that ability for us to save for our retirements has been eroded over the years. And so, you know, one suggestion that we're asking is that might it be a possibility to help support our local physicians by allowing them to participate in a similar sort of program that is available to all other government workers, such as pension and benefits. So that might be one more thing that would assist not only with recruitment for family physicians here in Belleville, but also, and more importantly, from where we work on the front lines, for retention of the physicians who at this point are continuing to work in Belleville. But as Dr. Greatson has mentioned, it's becoming more and more challenging to continue in this role with the rising costs and the inability to offset that and to prepare for our own retirement at whatever point that does come. I'll pass you on to Dr. Perrier.
Good afternoon. Thank you all for having us here today. So I come with a couple of hats. First of all, I'm a family physician, and I've actually been here for 8 years. It's a little auspicious. It's close to my 8-year anniversary at the beginning of May in practice. And so I just want to start by saying, you know, not only are we physicians in your community, but we're members of the community. We have homes here, we have families here. Many of us have had our children here. I've had my 2 children here. We receive health care here too. So not only do we deliver it, but we receive it. And so we understand the crisis at many levels. We operate in it. We operate with public health. So, you know, hearing that presentation is it's actually very exciting to hear that we're moving towards some systems that are going to support care delivery for our communities and for the wider community. So in saying that, you know, we're here today because we're in dire straits and we need some help. And we're saying that at many levels. I work with the Ontario Medical Association. I'm the president of our local chapter. I'm the chair of our district for District 6. And I also work with the section on general and family practice, serving as the physician lead for the policy and advocacy committee there. So I work at the provincial level, I'm aware of that. And we're not asking you for a provincial solution. We're well aware that that's not in your hands. And we're working hard to get that. But what we do need is some help on the ground, and we need it fast. We're really floundering. We're having a tough time. And so this idea of physician retention is not a new idea. Dr. Brown and I have had conversations with Karen in the past. This has happened for over 2 years. I've talked to people. Other of my colleagues have talked with people as well. And so it's a little frustrating from our side to feel this conversation and this output and this request is not new. It's not a fresh idea. It's long-standing. Other communities are doing this. We need your help. We need your help to make this feasible. I want you to just look at the physicians behind me and who's come here. And part of this is recognizing that we are physicians in mid-career. And that means we have flexibility in our careers. Many of us have been building skill sets to facilitate exit should we need to, because our current model of community comprehensive care is simply not a sustainable business model. We are floundering. Many people are doing other things to support their community practice. What business sense does that make, to do one thing to fill the hole of the other that is losing money? It's not sustainable, and this is why my colleagues are moving away from community-based practice, moving into these settings my colleagues have mentioned that don't have overhead. We additionally know that patients who have community comprehensive care physicians who care for them over a spectrum of time have considerably better health outcomes. And just as a personal pitch, there are also stats to show your health is better when you have a female physician. It's true. Sorry, guys. But we are transferable, and I think that's an important point, right? We have a lot of older physicians in our community who are close to retirement. Many are retiring or imminently. The bulk of our workforce is mid-career, and if this is not a sustainable model, and we can't work with not only our provincial government, but our municipalities to make this into a sustainable model, we will be leaving practice, because this is our career, this is our job. We need to pay our bills as well. And we can't be paying into a business model that has no end in sight to become actually sustainable or create an income that we can live off of. Many of my colleagues have paid to work. Think about that. Many of my colleagues have paid for the privilege of working, not taking anything home, to work. And why do we do that? Because we know how important the care is. We know, and we don't want to sacrifice that. So I hope that our message around sustainability and assistance really comes through. There's so many ways that you can support us in this that are doable, that are accessible. It doesn't have to be big things, small things count too, right? A 5% reduction on utilities, magical, right? That would really help our clinic functionality, right? Any way that we can facilitate support to our community practice family physicians is really where we need the support. And that's to sustain the health of our community. And so what I offer you today in closing is that this is an opportunity for the city of Belleville. So we've seen the news articles about recruitment and how successful you're doing, and we're happy to see that. And we see that Belleville's advertised as a safe, lovely community. We've got a great community of physicians. But we're telling you it doesn't feel that way on the ground. So please hear this message, because this is your opportunity to step up and to support us and to help to create a solution that we can work towards as a community and to actually truthfully make Belleville an incredible place to be a family doctor. Thank you.
Thank you. Questions? Councillor Millett?
Thank you very much. And doctors, I can't tell you how powerful your message is and how much it's getting through. As someone who lost a longtime doctor here and benefited from some of you coming here, I'm a beneficiary of that at this point. Just so that you know, at the end of this meeting, under new business, we will be bringing a motion that will be circulated to the province, asking us to advocate on your behalf at that level. I'm also going to be bringing a motion asking for a staff report to investigate some of the suggestions that you're bringing to us today. I think, you know, it's the very least we can do to at least use staff resources to consider and work with you to see where we can find common ground. The last thing we need is to see any of you leave at this point, because you simply can't make it go. I can't tell you how much it angers and disappoints me, not disappoints, just angers me when I hear doctors coming to our podium here saying that the messages they're hearing and the anguish that they're hearing is soul destroying. Dr. Whalen, you use those words. I know we hear the same pleas every day from some of the people in our community because they expect us to help be part of the solution. I want us to be part of the solution. So thank you for your message today. I can't tell you how much it has resonated with all of us around this table. we will work with you. Thank you.
Councillor Thompson?
Thank you, doctors, for coming. I'm very fortunate to be a patient of one of these doctors that are standing here, so thank goodness that we have the dedicated doctors in our community. And, you know, again, we're talking about a provincial and a federal situation that we shouldn't be dealing with. But you're telling us if we don't, we're in worse shape than we're going to be. So that I would like to ask if your organization would, and it's certainly a bit on Councillor Millet's, or what he's going to ask for is to work with Karen Post, to give her a list of things that you feel are important that we could possibly look at as trying to help our doctors, your families, stay in business. And it is a business. It's a business to serve us, and we need you. So I would ask if your organization would work with Karen Post and bring some of those issues to her that us as a council and the mayor could possibly work with in our budget to say, can we help? We certainly help with doctor recruitment. We certainly make donations to the hospitals. But again, here we are trying to subsidize the provincial and federal government to keep you, and we need that. So I thank you very much. So, and I know I'm supposed to ask a question out of this, so my basic question is there one thing that would probably be the first step to helping you in your keeping your family doctors here? Is there one that you would consider important for us to at least look at? I have to ask a question, so.
It's a fair question. So I don't want to assume, but I'll speak for the group as best I can. Not to be crass, money.
Yep.
Why? Because some of us need help with staff, like being able to pay our staff, to be able to keep staff, to be able to function. Some of us need help with, tools like our electronic medical records, some with utilities, some with rent. And so it's difficult to earmark and say, there's one specific area of focus.
Yeah.
However, funding is the key piece that we are really struggling with right now.
Yeah, and I'm a little alarmed at $38 because I chair the EMS for the county of Hastings, and we have EMS people going into homes so they don't end up in a merge. And I'm going to make an inquiry to see what they're being paid for that one visit. And if it's a lot less or more than what you're being paid, then there's a problem there, because you're getting 38. If it's costing us to send paramedics to that one house, which is great, because it saves them in the hospital, but if we're being assessed $80 or $100 for that visit, then that's not fair to you people. Thank you.
And for the bulk of us, it's a percentage of that $38 as well. So.
Thank you very much, Doc.
Councillor Enright Miller?
Thank you, Your Worship. And thank you, ladies. There's a common thread here. We have women in business here, and being one of those women in business in Belleville and having a staff and overhead and all of that goes with it, I share your pain. Private sector, we can go and increase our fees. This was shocking. You can't. So I think we've heard you loud and clear, and to Councillor Millet's point, we need to help you. We're so busy retaining, or not retaining, trying to bring in new docs. We need to look at what's happening with the docs we have. So thank you very much for your presentation. As I said, these numbers are staggering, and I think we're going to help. I'm hoping we're going to help, and quickly. So thank you so much.
Councillor Kelly?
Thank you, through you, Mayor. Thank you, doctors, for coming today. Reality check for all of us, and hitting us big time with the facts and figures. I'd like to direct my question to the lead doctor, Dr. Whalen. Doc, there was a report that came out today. I don't know if everybody saw it, but work in the media business, I happened to catch it. 33,200 more nurses needed for the province of Ontario by 2032, and 51,000 PSWs. And when we went through the pandemic, just for transparency, I'm on long-term care for Hastings County, and followed the medical community, if you will, throughout the pandemic. And the light was shining brightly, and PSWs and nurses were getting a top up on their wages through the pandemic and after. And then I also read this morning that Ontario is spending $170 million, the province, on retaining like job services for nurses, like they call them staffing agencies. So that's $170 million. So nurses are leaving the profession to say, I'm going to work for an agency. I'll make my 75, $100 an hour. The agency gets their 60. Everybody's happy, and I'm not loyal to anybody. And I can see where they're going with that. So you talked, Dr. Whalen, about the crisis mode, and thanks for the message from all the doctors. 52% of family doctors, once they graduate, go into business, right? And here we are in the city of Belleville, reaching out and signing doctors. And our goal, I believe, as leaders here around the Horseshoe and our community is to welcome them, engage with them, make them feel a part of our community, and we want them to stay. And then you come today, the doctors, and paint a different picture. My concern is that we get the doctors to come for the 3 or 4 years. And what you're painting today is not a pretty picture. It could be even more of a crisis by 2028 for the city of Belleville. So the question is, $38 a day, $350 for emergency, that's the bill they get, OHIP, if you go to emergency. And what is the attraction to go into medicine? Like really,
That
like
is an
what's the
excellent
attraction?
question, Councillor Kelly, and I ask myself that every day. The attraction is our long-term relationships with patients, and fundamentally all of us love what we do, but the demoralisation from the provincial government is just taking over from that joy of our jobs. And, you know, we talk about all the costs we have. The government just keeps adding more and more costs to us. Like, now you need to have an online booking platform for your patients to get, you know, up to date on technology. And they'll initially give us some funding for that, but then once the funding's cut off, that's another cost for us. They want us to be able to email our patients. Again, we'll get funding initially, then the cost falls on us. And, you know, even in the time I've been a family doctor, we have every single insurance you can ever think of, because if we get sick, we're screwed. We're screwed. We now have cyber insurance in case we're hacked. Every year the cyber insurance goes up. Like, it's just increasing costs every single year without any associated increase in our fees. And that's why we're here today, is because we want to stay as family doctors. We want to retire in Belleville. It's one of the reasons we chose Belleville as a place to practice. But it's getting more and more difficult. And I'm originally from Ireland, and I have looked at how to reinstate my license in Ireland, to be perfectly honest. Like, if my kids go to university in Ireland, I may leave Belleville and go there too, because we cannot sustain this. And you know, we were very badly affected during the pandemic because we did not get any payment for PPE. We had to fund that out of our own earnings yet again. And a simple thing like a box of masks, which we would buy for flu season every year pre-pandemic, cost $4.77 for 50 masks. Once the pandemic hit, that same box of masks was $55. And the government did not support us at the beginning of the pandemic with any PPE, but yet they were supporting everyone else in the healthcare system, every other sector. And so for us, it's just become completely untenable to continue on. We also got a memo from the Ministry of Health, which I memorized every single word of in November 2022, saying, "Dear Family Doctors of Ontario, thank you for your tireless work during the pandemic. Now that COVID has started to decrease in our communities, we're seeing a resurgence of many other viruses, so you now need to open your offices 7 days a week and every evening to accommodate patients to keep them out of the emergency department." And of course, none of us can do that. My staff will not work more than they already do. They go above and beyond every single day. So why do we do the job? Because we're altruistic, Councillor Kelly, and it's part of who we are, and the government takes advantage of us. There is the answer to your question. And it would be very shameful for us to walk away purely because the government do not pay us any respect. And the difference between us and the nurses is the nurses have an extremely powerful union. We do not. because that was written into law in Ontario, maybe in the 90s, that we cannot unionize. So we cannot strike, you know, we have our bargaining association that we pay very large fees for every year, who campaign with the government on our behalf. And I'm sure you heard on the news about arbitration is currently ongoing. And our OMA are looking for some of the Bill 124 fallout for doctors, but the Ministry of Health have conveniently forgotten about that for doctors. They're willing to give us a 3% raise, which will not, it's kind of like putting your finger in the dam. Like it's not going to work to keep doctors being doctors in their offices. So there's a very long-winded answer to your question. Yeah.
Councillor Carr, and then
Thank you, Mayor. Thank you, doctors, for coming. I look forward to debating some of the things that we could possibly do at a municipal level, but I want to maintain focus at the provincial level where it really needs to be. We tend around this table to start to fill that vacuum, and then there's an expectation on the residential taxpayer that we are going to fix the issue that really the province should be fixing. So a couple simple questions. Approximately how many times has MPP Todd Smith been contacted in relation to these concerns? And also, how many responses have you received from those times that you've contacted?
So I can go first. I personally sent him a very long-winded email. I think it was March 2022, outlining the crisis that we're facing, and particularly being part of the residency program here and seeing it firsthand, how nobody's choosing family medicine. And I remember one of our first graduating residents, I think it was 2016, where he finished residency and he's like, oh, I'm not going to open up a practice. And I was shocked because I'm like, that's what you're supposed to do. But he's just been locuming for 8 years and, you know, no overhead. So I sent MPP Todd Smith a very long email outlining all of this and never received a reply. I followed up on the email a few weeks later, never received a reply. When we had our meeting with Mayor Alice and Karen in early April, he was invited to attend but didn't show up. So that's from my...
Did he reply to that request?
sorry, Paul.
Yeah, that's fair.
Councillor Carr. Did he reply to that invitation? Yeah. Showing up, they wouldn't come, or? Karen, sorry.
I can confirm that I believe his staff indicated he was not available.
Okay,
Okay,
thanks.
well, there you go. I will take that comment back then.
And
But has not replied to my calls for help.
Okay.
Yeah.
And then equally, and it may not be known, but MPP Rick Barisi, who represents Hastings, Lennox, and Addington riding, actually is in part of Belleville as well. Anything north of the 401 is actually MPP Rick Barisi. So he should not be let off the hook either. We're one of those municipalities that has 2 MPPs, so you may get a silent response, but he also needs to be engaged in this process. Is it fair to say that the majority or what really causes an anchor around your necks, if you will, in terms of the cost, is the overhead? At the end of the day, a British Columbia model where the overhead gets taken care of. And I look at nurse practitioner clinics, for example. They get funded from the province, so all that administrative costs are handled. They're also salaried, and so it's kind of, there's the money, make it happen. Where I get the impression that a physician's practice is very piecemeal in that you get a little bit, but there's a lot underneath that you have to try to cobble together to make ends meet. So is the British Columbia model a model that the province of Ontario should be looking at?
I think, to answer your question, the overhead is our biggest source of income loss, and that just increases year over year over year. And it's also hard for us to, when we are hiring for staff, to compete with other medical professionals who are looking for administrative staff, because we cannot give the hourly salaries that hospital workers get, or dentists or optometrists, you know, because they can set their own fees. And so for us, it's tricky to get staff in the first place. And then, you know, we're nice employers. We want to meet our staff when they ask us for a raise. I don't think there's a quick solution to the problem, but the biggest solution is paying us for the work that we do. So for the patient-facing time, but also all of that extra work afterwards, where we have to look up results, we have to deal with abnormal results. Like, all of that stuff goes unpaid. And I can speak for myself saying that I've reduced my patient-facing time because I almost have so much paperwork these days, I don't have time to see the patient. And when that's the unpaid part of the job, you're thinking in your logical brain, this makes absolutely no sense. But if I don't do that, then it takes away from my time with my children and family at weekends, takes away from their activities, you know. And speaking about locums, like when I go on vacation, I still do my own inbox when I'm away, because it costs us more to pay for a locum than we get paid. So it's not financially sustainable either.
I've said in this place too, and my last question, that I truly believe, I don't think the province wants everybody to have primary health care, because if it's on a per visit basis, I think they're a little petrified of that OHIP card being swiped and the bill that comes with it. I say that to say there's only so much money to go around. I'm going to ask this question, it may be fair, it may be unfair. If you don't want to answer it, that's reasonable. Do you think the provincial health bureaucracy is bloated?
Yes.
In terms of money that goes to, oh, there you go.
Yes.
Okay.
And from my understanding, I think that this will sound bad, but I don't think the government actually cares about the health care of Canadians. I think it just cares about the bottom line for that dollar bill. And when you see them investing in millions upon millions and a lot of other things, it's, I'll use that word again, soul destroying for us, when we would like to look after more patients and keep them out of the hospital, but our hands are tied.
Okay.
Yeah.
Thank you.
Councillor Brown?
Thank you, and doctors all, ladies, thank you so much for what it is that you do for our community. A question, because you have mentioned that without success you have not been able to have a conversation, have a dialogue with our MPPs here in the city of Belleville. Have you at any time gone to the media?
We're too busy to go to the
Well, that's actually what I wanted to say about your previous comments, kind of the same issue. So, you know, if you look at us, we've all taken time out of clinic and work to be here. That's a considerable amount of income lost so that we can provide a show of force and solidarity to be here for this message today. And realistically, it's not something we can do in repetition. It's just not. And so it's the same with trying to contact our MPPs and our government, is doing this repeatedly over and over and trying to sit there, write emails, follow up on that and do this. It's a prioritization issue. And if you're not getting an answer at some point, it falls off the list, right? If we're not getting anywhere, we don't actually have the time to keep banging our heads against that door. So it's not that we don't want to. It's, again, it's in the box of more unpaid work. And when the other work is, you know, your x-ray, your MRI, your blood work results, which one's trump? So
from that perspective, and I can speak from experience, you call out our MPPs, they might follow you up the next day with you. So I think it's imperative to continue making as much noise as you possibly can, calling out, because, and I'll echo, I think, what's been said by Councillor Carr and by Councillor Thompson, is municipalities have a very defined role in what we should or should not play in. The Ministry of Health is a provincial issue, but we also acknowledge the fact we just can't be pointing to another level of government and saying it's their problem. It's our problem because it impacts every one of our residents here. A local resident doesn't care if it's a healthcare issue, it's a provincial issue. The first line of defense is their municipality. So I think it's going to be deserving of a conversation, certainly with my fellow councillors, with the mayor in terms of, and staff, what it is that we potentially can do, while acknowledging, and I think it's really important for you to hear this, that we're playing way outside of our lane when we have those conversations and we make those investments. It's not that we don't hear you and support you fully, but we also have to play within this lane.
I think we very much support that and respect that, but I will also say respectfully, I disagree that it's outside your lane. I think what we're asking is that you revisit the idea of a recruitment committee, and it should be recruitment and retention, right? And that's a piece of showing value. And as I said, I work with OMA. Believe me, there is a lot of effort and work going into arbitration and all of the work towards that. It's not perfect, but there's a lot of work that's happening there and working hard for family physicians. In the same respect, though, whether we get a great deal or not, let's say it's, you know, pie in the sky amazing, we're still going to be Belleville with the same amount of doctors.
Understood.
Right? And so this is about long-term planning, I think, and it's that retention should be a piece of what the city is looking at that helps physicians maintain and keep Belleville really attractive, and that's going to help support a sustainable and strong physician workforce that's not just at the hospital base, but that really supports family physicians and community.
Understood, thank you.
Yeah.
Thank you for your candor.
Councilor Alsop?
Yes, thank you, Mayor. And just very briefly, I echo all the comments of my fellow councillors. Thank you very much for being here today. One of the things that jumped out at me was the 19.1 hours a week that's spent on administrative work that's unpaid. I was just wondering, to what extent is that work required to be done by a doctor, or are there other people that could be doing that work, but because of funding issues and lack of cash on hand, you can't hire for that?
Yes. Yes, we certainly could offload quite a chunk of that to appropriately skilled people if we had funding available to do so, which again, you're absolutely right. Like, we see the ripple effect, right? If there's more funds to facilitate administrative coverage, that opens more time to allow for more patient-facing time, more appointments, potentially more patients in a practice. But as Dr. Whelan was saying, right, you have to cut back your clinic time because it's just not sustainable. You can't be doing 2-3 hours of paperwork every night just to keep up with the flow.
Well, certainly that was the challenge that I was appreciating, is that you get paid by visit to the doctor. You don't get paid for the paperwork that you're doing. If the doctor is spending half their time doing paperwork, that's also a loss of revenue as much as it is just unpaid work as well. So something needs to be done about that. And then locally, do you have a sense of what percentage of doctors rent their property versus own their property? And so to what degree would subsidizing rent be important versus taxation changes or change of property tax class?
I don't know many doctors who own the clinic. I'm sure I'm not the only one. My current clinic building is losing about $5,000 a month because we don't have the ability to pay the fees. And I'm sure the other medical clinics are very similar, and we don't want to put that off on the doctors and make the doctors just leave. So, but I don't think there's a ton that are actually working here that own the buildings. I think most people are renting.
The majority would rent.
Just predominantly rented, okay. Because as a small business owner myself, the opportunity to purchase the building and then pay it down over a period of time as a business expense can be beneficial, but then the new changes in the capital gains tax laws are a little bit flimsy that way, so we'll see how that pans out. Okay, well, thank you very much for your time. We'll certainly be investigating some of these solutions that you've been proposing, and hopefully we can get you a better deal in the future.
Thank you for a great presentation, and maybe we could send a copy of it to our two MPPs.
And I believe there's a Dr. Pincock here just to go over the Ontario Health teams as well, a quick overview.
Okay.
Thanks all. My name is Dr. Pincock. I am the primary care co-lead for the Hastings and Prince Edward Primary Care Council, which is a subsidiary of the Ontario Health Team. These folks did a fantastic job, and I think have said most of what I want to say, so I won't take very much of your time. I will outline just a few things going on with the Ontario Health Team and how it pertains to our community, because I think it helps frame some of the challenges in primary care. Hastings and Prince Edward is a long, narrow region that is supported by Quinte Health and by a variety of talented primary care physicians and nurse practitioners through all of our communities. However, it is large and it is predominantly rural. So we have a significant population living in our community who live in small towns and rural areas, a number of seasonal residents, which makes attachment and care challenging. And we have sustained population growth greater than that of the provincial average. Of our population, we have a relatively older and sicker population with many more chronic health conditions. Only 54% of the population would rate their health as good or very good, which is lower than the provincial average. We have a higher rate of mental health problems than the provincial average. And we have a significantly worse social determinants of health than the rest of the province, including difficulties with alcohol and other substances, which I'm sure you're all familiar. 1 out of 4 members of our community is over the age of 65, and they're more likely to require hospitalization and other sort of more advanced levels of care. There are challenges with a lot of newcomers. We have a large Indigenous population, and we also have a relatively larger challenge with respect to accessing healthcare just because of geography. Because our patients live rurally, they have difficulty accessing us if we don't live reasonably close by, and if for some reason they don't have access to a vehicle. I just want to highlight a few things about the nature of primary care in our region. So we have a lot of patients who are cared for in by family health physicians. So family physicians care for most of the population, and then we have about 3,200 residents who are cared for by the nurse practitioner-led clinic. We also have care provided by the Indigenous Interprofessional Primary Care Team in Tyendinaga, 2 community health centers, and the rest being primary care physicians. So we have in Belleville, we have the Queen's Family Health Team, which is our only team-based care group in Belleville, and we have the Belleville Family Health Organization, which unfortunately is not a part of team-based care. So this is our healthcare workforce for the entire region. We have a number of vacancies. We could recruit another 44 physicians, another 5 nurse practitioners. And it's expected that we'll need to recruit in addition to these vacancies because of expected retirements and departures. So we have lots of pressures in the health system, and again, this is meant to frame our discussion of what primary care is trying to deal with, and these are not necessarily issues that the City of Belleville is going to be able to help with, but your advocacy for family physicians is very much appreciated. Issues that are barriers are physician services agreement, virtual care billing negation, inequitable access to team-based resources, and a scarcity of health human resources, including physicians and nurse practitioners. As my colleagues have mentioned, family physicians have options in where they work. They have a unique skill set, and to be honest, without family physicians, especially in Hastings, Prince Edward, we would not be able to offer all of these services. Hospital care, emergency department coverage, oncology care, long-term care directors, surgical assistants, anesthesia services, retirement home coverage, hospice, maid services, as well as teaching and coverage of some of our community clinics, such as the influenza clinics that were, influenza-like illness clinics and COVID clinics that were run during the pandemic. So the short message is that we have a lot of challenges that we face locally. We have a large unattached population. We would from the position of the Ontario Health Team, we would very much love the city's participation in in helping us overcome some of these challenges and advocating on our behalf. In the most recent announcement regarding funding for primary care from the province, the province undertook a submission process for organizations to request funds for team-based primary care. They offered approximately $38 million to the entire province and received hundreds of submissions, most of which were not funded, none of which in Southeast Ontario were funded. We have a very large family health organization in Belleville that does not have any funding for allied health services, and which did not have their proposal to become a family health team funded in the last round of announcements. The physician services agreement continues to be a major sticking point, and I don't think I can say it any better than my colleagues already have as to the financial challenges that physicians face. As far as what the City of Belleville is able to offer, as we look at the health of our community writ large, any opportunities that allow us to develop service plans for our unattached populations, our marginalized populations, our populations who struggle with addictions and mental health. If there's any opportunities to partner with the city on especially those areas, that would be welcome. And if there's any opportunities to partner with the city as well, like my colleagues have mentioned, in terms of recruitment and retention to help mitigate the impending crisis that we are facing simply from demographics, that would also be welcome. So thank you very much.
Thank you. I need a motion to receive. Councillor Alsop, Councillor Enright Miller, all in favor, carried. Thank you very much, and thanks. We'll be in the news tomorrow, hopefully, or you will be. With that, I'd like to have a resolution that on April 19th, a letter from Hastings Prince Edward Public Health in connection with carrying out mosquito larvizing activities be prevented or control West Nile virus in an area if deemed necessary, be supported and approved. Moved by Councillor Enright Miller, seconded by Councillor Kelly. All in favor, carried. Need a motion to go into Committee of the Whole to hear and consider reports, recommendations, and resolutions with Councillor Brown in the chair. Moved by Councillor Alsop, seconded by Councillor Enright Miller. All in favor, carried.
Moving to item that committee reports number 8A. 8A1, City of Belleville 2025 Capital and Operating Budget Timeline and Community Engagement Strategy. And the resolution reads that Council approve the recommendations of the Finance Committee as outlined in the Director of Finance Treasurer's Report, DF 2024-10, and approve the 2025 Capital and Operating Budget Timeline and Community Engagement Strategy. May I have a mover, please? Thank you, Councillor Enright Miller. Seconder? Thank you, Councillor Kelly. Discussion. Seeing none, all in favor? Thank you, the motion is carried. Item 8A2, Asset Retirement Obligations Policy. Resolution is that Council approve the recommendations of the Finance Committee as outlined in the Manager of Finance Deputy Treasurer's Report DDF-2024-04, and approve the asset retirement obligations policy. Mover, please. Thank you, Councillor Alsop. Seconder. Thank you, Councillor Thompson. Discussion? Seeing none, all those in favor? Thank you, the motion's carried. Item 8A3, removal of an H holding symbol at 24 Adrian Street. Resolution is that a bylaw to authorize the removal of the H holding symbol for 24 Adrian Street, formerly 645 Sydney Street, City of Belleville, County of Hastings, be prepared for council's consideration. A mover, please. Thank you, Councillor Alsop. A seconder. Thank you, Councillor Kelly. Discussion? All in favor? Thank you. The motion's carried. Item number 8A4, Equity, Diversity, and Inclusion Committee 2024-26 Strategic Plan and Objectives. The resolution is that pursuant to the CAO's report number CAO-2024-04, Equity, Diversity, and Inclusion Committee 2024-26 Strategic Plan and Objectives, Council approved the 2024 Strategic Plan and 24-26 Strategic Plan and Objectives for the Equity, Diversity, and Inclusion Committee as outlined in the report. A mover, please. Thank you, Councillor Kelly. A seconder, Councillor Thompson. Discussion? Thank you, Councillor Kelly.
Through you, Chair, just wanted to just touch on this briefly as I'm the chair of the Equity, Diversity, and Inclusion Committee. Councillor Brown quarterbacked the strategic plan for the committee, several meetings, and it's nice to see it on paper, and thanks to Councillor Alsop for his input as well and on the committee. So really appreciated you stepping up. Your experience in your previous work was certainly prominent over those several meetings. So thank you, Councillor.
Thank you. Any other discussion? All those in favor? Thank you. The motion's carried. 8A5, the R-Zone policy. That Council endorse the R-Zone policy attached as Appendix A, and that the necessary bylaws be prepared for Council's consideration. Thank you, Councillor Millette, seconded by Councillor Enright Miller. Discussion. Councillor Millette.
Thank you, Chair. And through you to, I guess, Director Hustwick, who I see is here. It's unfortunate that, first off, with just a little preamble, that we have to enact a policy whereby we have to formulate what is acceptable and what isn't acceptable anymore, but such seems to be the way of society these days, and I don't know if it's since the pandemic or if too many people are living their lives online and fanning flames of what they believe is acceptable. I think we saw a flagrant example of it a year ago or more when the Prime Minister visited these chambers, and when he stepped outside, we had a flock of hooligans who thought it proper to be able to call them all names in the book, shout profanities, prevented him from making his way around the market square, cutting his visit short. And in fact, it was not only a black eye for the city, it was a black eye for this region, and they seemed fine with it, these cretins. So, I mean, that's an example in the extreme. But I guess my question to Director Hustwick is, Mr. Hustwick, is this happening in arenas? I see that the background on this policy is in recent years has been a noticeable rise in inappropriate behavior leading to incidents at our municipal facilities, properties, and programs, including city-sanctioned events and programs held at non-municipal facilities. So, can you give us some examples? I mean, are our staff being abused in our facilities? What brought rise to this, the need for this policy?
So if I could direct that to Director Hustwick.
Sure. Through you, Madam Chair. Thank you very much for the question, Councillor Millette. Just to provide a little bit more context, at the end of 2023, staff created a working group with representatives from most of the city departments to look at more broadly the safety and security of all municipal facilities. So we reviewed a number of key areas that included proper coverage and operation of security cameras, panic buttons, alarm monitoring, access cards as well as security guard usage. So it was, we started sort of at the foundation, looking at all of the types of issues that are being dealt with across the municipal area. We've also been working with the police on preparing to do CPTED evaluations, which is crime prevention through environmental design. And we also looked at the types of policies that are already in place, and we identified a gap in terms of having a policy that clearly outlined the type of behavior that's acceptable at all of our facilities, as well as being able to provide consistent guidance to staff in terms of how we deal with members of the public related to those types of behaviors, but also, perhaps more importantly, consistent approach at how we address those types of violations. So while we deal with incidents and inappropriate behavior on an ongoing basis, this is providing a consistent approach to how we deal with that, guidance at all facilities. And we are experiencing, certainly at the library, at City Hall, at the sports center, these are either inappropriate language, tone, behavior dealing with staff, but it also involves inappropriate behavior between clients, participants in programs that get angry at each other and create incidents. It also, and so, I could go on with a lot of different examples, but the severity may be just language, but it may actually escalate in some cases to physical interaction between people. And certainly when we look at City Hall, our concern always is members of the public certainly view elected officials as representatives of the city, and we are actively discussing safety for staff and council in this facility as well, and that's one of the things we'll be looking at with the police when they do the CPTED evaluation of City Hall. So there's endless types of examples, but we're hopeful that council will support this, and not only will it provide guidance to staff, it will also provide us with a good marketing tool in terms of the R-zone that has been used in many other municipalities, to share that, market it, and educate members of the public of what is appropriate behavior, and if they breach those expectations, what they may have to face in terms of sanctions. Hopefully that answers your question.
Thank you, Mr. Husvik, and through you, Chair, to Mr. Husvik. Yeah, that answered my question. It's unfortunate that what some people consider as their right to free speech, if you will, has now carried over into loutish behavior that can veer into the realm of violence and or bullying, intimidation. So here we are. It's 2024. Thank you.
Councillor Alsop?
Yes, thank you, Chair, and I just wanted to voice my support for this R-zone policy. I think this is something that's very important because it provides consistency across the organization, not only in terms of what is acceptable and what is not acceptable, but then what steps are then taken with these individuals who are breaching that protocol, so that they get a similar level of treatment across the organization, and not, differences when they do something at City Hall versus at the recreation center. I think it's important that that is one policy for the whole city. It's a shame that we do need it, but certainly we do. I was talking to Director Husvik earlier today and recounted a story about how leaving one council meeting during COVID, people were certainly upset about some things that were happening. And I was surrounded by 10 members of the public who took umbrage with some of the policies that we created. And it got a little bit heated at times, and this wasn't something that at the time I felt was an unsafe situation. I kept reminding everybody that they need to stay at least 3 feet away. And they said, well, actually it's 6 feet. And I said, no, you just can't be yelling at me if you're closer than 3 feet to me. Nothing to do with COVID. You can't come that close if you're going to be this angry. And they mostly respected it, but it was one of those things we realized that if a couple people in that group were different people, or they came with a different attitude or intent, it would have been a real problem. And so I think by having this policy in place, it's going to do a great job of keeping everybody, both staff and members of the public and elected officials, safer and feeling more comfortable.
Any other discussion? Then call the motion. All in favor? Thank you. The motion's carried. 8A6, delegation of head under the Municipal Freedom of Information and Protection of Privacy Act, MFIPA, DCC-2024-01. And the resolution reads that council, in accordance with Section 3 and subsection 49, bracket 1, close bracket, of the Municipal Freedom of Information and Protection of Privacy Act, MFIPA, delegates all of its powers and duties as head under MFIPA to the Director of Corporate Services / City Clerk, and that a bylaw to be prepared for council's consideration. A mover, please. Thank you, Councillor Enright Miller. Seconder? Thank you, Councillor Alsop. Discussion? Thank you, Councillor Millet.
Just through you, Chair, quite quickly, I don't want to belabor this, through you, I guess, to the clerk. It's good to see that we are entering into the EDRMS, Electronic Document Records Management System. Currently, do we have a hybrid of electronic documents and paper documents? And if so, where are we storing and how are we storing, or for security reasons, can we say do we have just like endless warehouses of bankers' boxes somewhere? But I'm just not familiar with what exists now.
So I'll refer your comment question to the city clerk.
Through the chair to Councillor Millet, a little mix of all of that, and that's the unfortunate truth of it, and why we're trying to become more compliant. So modernizing it, the reason for the report is to become compliant and position-based in the delegation. The current delegation bylaw lists people's names, which is not really appropriate when people come and go, so it's position-based, city clerk. The Act delegates to council responsibility under the Act. I don't think you want it, so I think it's appropriate to delegate it to the city clerk and then the clerk's office. But yes, lots of electronic records. Cautioned you in the past. Your text messages, your emails, all city staff, all correspondence is a record of the corporation. And absolutely, we have reams and reams and reams of bankers' boxes full of corporate records that we are more interested in having electronically from this point forward, so that it's easier to respond to requests of this nature.
Thank you very much.
Any other discussion on this item? Seeing none. All in favor? Thank you. The motion's carried. Item number 8A7, appointment of members to city committees / Accessibility Advisory Committee and the Transit Advisory Committee. Report DCS 2024-05. And the resolution reads that pursuant to the Director of Corporate Services Clerk's Report number DCS-2024-05, appointment of members to city committees, Accessibility Advisory Committee and Transit Advisory Committee, that a bylaw to amend bylaw number 2023-09, the appointments bylaw, be prepared for council's consideration. May I have a mover, please? Thank you, Councillor Enright Miller. Seconder, Councillor Carr. Discussion? Seeing none, all in favor? Thank you, the motion's carried. Who picked this agenda? It's long. Item number 8A8, Building Automation System and Lighting Upgrade, Quinte Sports and Wellness Center, Report FM 2024-01. Resolution reads that in accordance with Section 30.3, sole and single sourcing, approval and reporting of the city's purchasing bylaw.
I move as read, Chair.
Thank you, Councillor. A seconder, please. Thank you, Councillor Enright Miller. Discussion. Councillor Thompson?
Yeah, just one on the cost. The budget's 1.355 million. And this one comes in at 354, which leaves a remaining budget of 1.205. Is there more coming under this budget? And why the budget is 1.3 and we're only spending, is there more coming in under this budget?
Thank you. If I could direct the question to Director Huswick, please.
Thank you, Madam Chair. Councillor Thompson, yes, this is just one project within the overall annual maintenance for the facility. So during budget we provided a list of all of the types of activities that'll fall within the total budget. So this is just one item. It was part of that original submission and fully budgeted for.
Any other discussion? Call the motion, all in favor? Thank you, the motion's carried. Item 8A9, Nurse Practitioner Incentive Chamberlain, report number MPRR 2024-12. And the resolution reads that pursuant to the Manager of Physician and Recruitment and Retention, report number MPRR 2024-12, a bylaw be prepared for Council's consideration to approve and authorize an agreement between the Corporation of the City of Belleville and Madison Chamberlain to provide medical services as a nurse practitioner, and that the 2024 operating budget be increased by $350,000 for doctor recruitment costs, and that the funding be provided from the Alexicon Reserve Fund. May I have a mover, please? Thank you, Mayor Ellis. Seconder, Councillor Alsop. Discussion. Mayor Ellis.
I just wanted to make a comment. Manager Care Post is here tonight, and I know that she's been busy, and with this nurse practitioner, I believe that's 5 now? 6, 5.
Mayor Ellis, could you turn on your mic, please?
So, yeah. And again, Karen, you've really done a great job on the nurse practitioner, and as you're well aware in the news, over the last 6 weeks, you've been able to recruit 5 more doctors, and hopefully at bylaw we'll have a number 6. So congratulations, Karen, and thank you for the hard work.
Thank you. Any other discussion on this item? Thank you. All in favor? Thanks. Motion's carried. Item 8A10, 2025 pre-budget approval for fire suppression staffing, report FES 24-03. Resolution reads that pursuant to the Director of Fire and Emergency Services, FES 2024-02, that the 2025 pre-budget operating approval be provided for the addition of 4 new captain positions starting January 1st, 2025, in the amount of $543,500, and the amendment of the 2025 pre-approval for 4 new firefighters, hire date from December 2025 to January 1st, 2025, in the amount of $370,000 to be funded through taxation. A mover, please. Thank you, Mayor Ellis, and thank you, Councillor Enright Miller. Discussion on this item. Councillor Thompson.
Yeah, if I could have the chief answer a couple of questions. On the page 2 of 4, you state that the minutes for the urban response over the past several years, calls volume within the urban area has increased annually by approximately 15 to 20%. So we're going to move to hire more firemen, and we've already pre-approved this in budget. So do we expect the volume that we're getting to decrease the overtime for firemen by adding new firemen at this point?
So,
Thank you. So if I could direct it to the Director of Fire and Emergency Services, please.
yeah, through the chair to Councillor Thompson, where we'll see some savings in overtime will be through our callback system. So as council is aware, many times when we have a large incident, it requires us to call in additional staff from our full-time ranks, and that immediately causes overtime. So with this additionally staffed pumper, it's an immediate crew of 4 personnel that can respond or be available to respond to the rest of the city while other staff are dealing with an incident. So where the savings will be around incident response pieces, yeah.
And the second question, you talked about a 15 to 20% increase on call volume. Do you expect with the call volume in that 15 to 20%, is most of those call volumes because of medical, or is it because of fire related?
So through the chair to Councillor Thompson, it's a big breakdown. So you know, when I look at the stats, we have 5-year stats that go from 2018 to 2022. I look at last year's stats. Medical calls last year were right in around 35% of our call volume. Fires, specific to actual fires, it fluctuates between 8% to about 14%. And then it spreads out from there, whether it be a rescue call, false alarms, they're in around the 20% mark year to year, so it does fluctuate.
And then you're moving the number of firemen from almost a year up ahead. What's the reason for that?
So that reasoning comes out of a recommendation from a closed session report previously received by council to move ahead with staffing a third pumper.
Okay, thank you.
Councillor Carr?
Thank you, Madam Chair. I don't have any questions, just some comments. You know, here we're asking for pre-budget approval, and you know, typically I'm very cautious about that. However, I want to just thank the chief for providing an extensive report that outlines the benefits for not only urban response but rural response. And I know that there's a fire master plan that will be public very shortly, which will provide greater detail and certainly outline some heat maps, which will clearly demonstrate to the public the need for this response. And so, you know, I think in order to get this operational, the pre-budget approval is required. I also will say that, you know, looking at the calculations here, it's about a 0.55%, which is approximately $22 per year on the average, $250,000 of assessment. And this is looking at it as a core service. And I think one of the things that's clear in this report here too is the fact that in order for the fire service to be at its optimal operational capacity, it requires that integration, and we have professional firefighters on both sides, both full-time and volunteer. But in order for us to adequately protect our community and have adequate response times, particularly when it comes to firefighters arriving at a scene in the event that they have to do an entry for a rescue, every minute counts. And so this certainly goes a long way. So it's a long way for me to say that the chief has clearly demonstrated with factual information the rationale and the subsequent results that we're going to achieve by making this investment now. Thank you.
Any other discussion on this item? Thank you, Councillor Kelly.
Through you, Chair, thanks to the chief for the report. And I think the one line that you stated in your report, response times for initial response will drastically decrease as response will be immediate, whereby the emergency vehicle can respond with lights, sirens, making sure that their arrival time is faster. Presently, volunteers will respond from work to home in personal vehicles to their assigned station. They are unable to maneuver through traffic the same way an emergency vehicle can. So with the new changes, things are going to be better. I read that line because people at home don't have access possibly to the report, but I'm just giving them the words, the golden words, that that information is there. Thank you.
Any other discussion on this item? All in favor? Thank you, the motion's carried. Item number 8A11, repair and rehabilitation of the primary power transformer and secondary bush bar for the Belleville Water Treatment Plant. Report number DES 2024-01. Resolution reads that pursuant to the Director of Environmental Services report number DES-2024-01, that the 2024 capital budget be amended to add an issue for the rehabilitation of the primary power transformer and secondary bush bar for the Belleville Water Treatment Plant in the amount of $100,000 to be funded by the Water Reserve Fund. A mover, please. Councillor Millette, Councillor Thompson. Discussion. Councillor Millette.
Thank you, Chair, and through you too, I see Mr. DeCola here. Always happy to see Mr. DeCola here. I read the report. I'm just to clarify this. It was a little troubling to hear that the extent of this short circuit and the event that evaporated a. First off, what's a bus bar?
Thank you. Director DeCola?
Through the chair, Councillor Millette. Bus bar is a primary transmission line, so it takes the three phases from the transformer and brings it into the primary power distribution center in the plant. In 2021 or 2020? 2021. We had a vaporization, so we had a dead short in the primary bus bar, not the secondary, in which 3 feet of the bus bar, which consists of approximately half-inch thick by 4-inch wide aluminum bars, and there's 12 bars in each bus panel, disappeared. Not a puddle, just gone. That it caused somewhere around $198,000 worth of damage. So we've been more diligent in the review of the transformer after that dead short, because that type of damage to a system can increase liability and wear and tear on the equipment.
And further to that, I noted in the report that we're only into, correct me if I'm wrong, 20 years into a 50-year lifespan for some of this equipment. Is that correct, or I may have read it wrong?
We're about 30 years in of the 50. We still have another 20 years of life left.
All right, well, thank you, and then let's just hope we don't have any vaporizing bus bars going forward. Cheers. Thanks so much.
Thank you. Any other discussion on this item? Councillor Kelly, did I see your hand up earlier? All right. All right, thank you. So all in favor, please. Thank you. The motion. Turn your mic back on. Council may adopt consent items by one motion, but prior to consideration of such motion, members may request that specific items be removed from consideration under such motion, and council shall consider such items individually. Going to my left, Councillor Thompson.
Remember that 8B3, I declared a conflict, and I think the other one is going to be pulled by someone else. So
Right.
I don't have really any, although I'm going to speak on one, but I'll let the person speak on this first.
Councillor Carr.
8B2, please.
Councillor Enright Miller.
No, thank you.
Councillor Alsop.
It's been pulled?
Thank you. Mayor Ellis.
No, thank you.
Councillor Millette.
No, thank you.
Councillor Kelly.
No, thank you.
Alrighty, so that the consent items be approved with the exception of item 8B2 and 8B3, do I need to pull it? No, okay. 8B2. Could I have a mover and a seconder, please? Councillor Alsop, Mayor Ellis. Any discussion on other items? Seeing none, all in favor? Thank you. So if I could return to item 8B2, value for money review for policing. The resolution reads that the Director of Finance Treasurer's Report number DF-2024-09, value for money review for policing be received. Have a mover and a seconder. Councillor Carr, Councillor Thompson. Discussion, Councillor Carr?
Thank you, Madam Chair. I have an amendment I want to present as well, that in addition to being received, that this matter be referred to the 2025 operating budget as a budget issue for council's consideration with a funding source of taxation, which would include the city undertaking such a review by engaging an independent consultant, and council submit a formal request to the Belleville Police Service Board for consent for participation in the review, and I'll speak to that amendment as well.
Thank you. Councillor Thompson?
I'll second that motion.
It's a friendly amendment. Sorry, so if I could open for discussion on the amendment, please. Yeah. Councillor Carr?
Thank you, Madam Chair. Before I provide comments, I just want to pose a question to Director Ferguson, Director of Finance, who crafted the report, and also I would like to ask the same question of CEO Bove. Is there anything within the request for the staff report which refers to or alludes to or implies that there is a request for an Ontario Provincial Police costing, to your understanding? If I could pose that question, Madam Chair.
I'm sorry, Councillor Carr. Thank you, if I could refer it to our CAO.
Through the chair to Councillor Carr, no, not my understanding that there was any reference to OPP in the resolution.
Director Ferguson, do you have any comments you'd like to share?
Through the chair to Councillor Carr, I would echo the same. There's no reference to OPP costing in that.
Thank you, Madam Chair, and thank you for both the CEO and the director to respond to that. And I want to make it very clear that is not the intent of the request here today. And it has been implied either through assumption, through past attempts, that this is what this is about. And that's not the case. I asked for this staff report back on February 26th, the day before we were reviewing our budget. And I'm going to speak frankly that we received very little detail from the Belleville Police Service Board in terms of the budget. And I have had a number of follow-up conversations with the chair of the Police Service Board, getting answers to questions I had posed on the day of the budget, particularly as it relates to the funding for new hires, and then trying to translate that out into the tax impact for not only 2024, but 25 and beyond, particularly when there's other pressures and increases coming. So again, I want to make it clear that this is not about an OPP costing, this is about a value for money review. And I did a little bit of research, and you know, on a very macro level, the Ontario government, as everyone knows, has an Auditor General, and they've conducted a value for money review with the Ontario Provincial Police, which is within their jurisdiction. That, for no reason, would suggest that the provincial government was going to disband or change the OPP because of the value for money review. I think the accountability and the scrutiny has to be there. So I did a little bit of reading, and interestingly enough, back in February, the City of London was going through their budget process, and there was a very large request from the Police Service Board for funding for the police. And in an article that was written by the London Free Press regarding the budget, Eric Lamming, who's a Trent University criminologist who teaches police accountability, wondered why there wasn't any debate at London Council. Police always want more money, he said, and I've not seen a budget where they want to cut costs, but there should be a debate about this. If politicians are supportive with no questions asked, that is a problem. And then he goes on to say that, or the article goes on to say that recent research questions the link between police spending and safe communities. And there's a Melanie Seabrook, who's a researcher at Upstream Labs with Toronto St. Michael's Hospital, who studied police spending and crime rates in London and 19 other Canadian cities last year. And she's quoted as saying, "There's an unprecedented increase in police spending across Canada, and that is why our research is getting attention. We are seeing giant increases in police budgets, and we did not find a clear association between police funding and a reduction in crime rates." And she finishes by saying, "I hope your counselors look at the research and take that into account." So this is simply looking at the costs. Another article that I found was the City of Hamilton. Now, the City of Hamilton has a city auditor as a department within the city proper. And they've actually were conducting a value for money audit that could unlock police creativity and innovation. And so this article goes on to say the turbulent demands and cost of delivery of police services in Hamilton require a long overdue value for money policing assessment, a reasoned assessment that challenges long-standing inputs, assumptions, policies, procedures, cost projections, and funding allocations, an assessment viewed through the lens of you, the customer, the taxpayer. And, you know, this is not for us to get into the nuts and bolts in the operation of the police service. The legislation is very clear, and that legislation is based on the rule of law, that your elected body should not be involved in the day-to-day operations of the police service. But the reality is what we did here at budget was an ever-increasing amount of calls for service. And so with that, the Police Service Board is looking at hiring. I don't disagree with the hiring, but the fact of the matter is you're just chasing the calls for service. And so if you're not doing things to reduce the calls for service, it'll be a never-ending game of trying to play catch-up as our city grows, and therefore the cost associated with more officers before the additional calls for service. Quite frankly, I was disappointed in the presentation that came before council. There was way more sensationalism and a lot less facts. And we scrutinize our internal city budgets quite extensively. And in fact, we'll remember in a previous budget, we had passed a motion, council did, for staff to go back and look for savings. And staff stayed late that night, very late at City Hall, to work out those scenarios and present options to council the next morning. And that's certainly appreciated and certainly helps us do our jobs when we have to make those decisions. We have from time to time scrutinized external budgets of Hastings County and different external agencies. And we've even questioned some of the service agreements when it comes to Hastings County. And I recall last term, we actually provided less monies initially to Hastings County than they requested, I think somewhat to send a symbolic message that tapping the brakes is necessary, and particularly more so in a time when inflation is hitting everybody hard and there's only so much money to go around. And I just feel that a value for money review would provide that option. So for today's motion and today's intent is no costing from the OPP. I can't stress that enough, because there was even dialogue as of last week on some of the local media, and it was disappointing that they didn't understand the context. So I want that to be clear. But today's motion is simply, we'll receive this, and I appreciate the staff report and what they're suggesting. But we are the paying customer, and the only way that we can determine whether we as the paying customer is getting value is for us to have it reviewed. An independent consultant will provide that. I think there is value for us, and there's also value for the police service, particularly as they undergo a senior management change. And this is an opportunity to flip the hood open and see what's underneath. And I also want to say that having worked on the front lines in corrections and law enforcement, it's a difficult job, and I get that. And I'm not for one moment questioning the work that is being done by the frontline officers or their performance. This is a macro level exercise that's looking at large dollar figures and how that is being utilized in order to provide policing. The results and how things are done and the deployments that occur, that's followed by a chain of command and is beyond the purview of us here in this room. So I want to acknowledge the hard work they do with the resources they have. So this motion here is just simply to refer it to the operating budget. We can debate at that time whether we want to allocate funds, whether we actually want to follow through with it and get consent from the police service. But I think at the end of the day, this is about just looking at the value for money and what we as the paying customer representing the taxpayers of the city fund for policing in the macro sense. And I'd request a recorded vote on this as well, please.
Councillor Thompson.
Yeah, thank you, Councillor Carr, for bringing the motion. I've debated this and debated it, talked to Councillor Carr about it, but I can go back to a number of years ago when the motion was brought to get OPP costing. And some around this table will know that I voted against it. And I still stand at this time voting against OPP costing. What I like about this motion is it gives us the opportunity, and the police force, the opportunity to review the operation. If they can save us money, it's the largest budget item on our budget. I think it's around 22, 24 million, Mr. Ferguson? 26 million? That's a considerable amount on a $130-some million budget. And I think we need to look at them and help the police force. And I think it's no better time maybe to do it in 2025 when we're going to be hiring a new chief and a new deputy chief and some new officers. This is an ideal time to make this, you know, when you get $26 million budget on 135 million is our budget, Mr. Ferguson?
Through the chair, the tax-funded levy for 2024 is 126.
126. So you got almost 25% of our budget is on policing cost, which is staggering, really, in amount 22 to 25%. So this here, in my estimation, is a good logical way to do it, to look in the policing, and as Councillor Carr says, we've done it with Hastings County to review theirs, and this way it involves the police, but it brings somebody outside of the community, bring it in to look at the budget, to look at their operation, and it's not at this stage, not saying it won't in the future, maybe look at OP costing, but at this stage, it's only a review. Thank you.
Councillor Alsop.
Yes, thank you, Chair. I first want to start out by saying thank you to Councillor Carr for his comments regarding this not having an OPP costing component. It got a little bit muddled there towards the end with maybe down in the future, another colleague suggested maybe it would become an OPP costing, but the initial point that was made by Councillor Carr was that this was not a step in that direction, and I certainly appreciate that, because I can tell you as chair of the Belleville Police Service Board, this is something that is not an easy thing for our members, particularly our civilian staff, who are very concerned about what that type of situation would mean for them. It is also not something that is advantageous or beneficial to us when we're trying to hire not only new officers, but a new chief and a new deputy chief, for them to be concerned about the specter of an OPP costing and their willingness to take the job under those circumstances should that be coming down the pipeline. So very important that we delineate what is being discussed here from an OPP costing, and I want to say I appreciate that off the top. Moving forward from there, this discussion about a value, cost per value, I think is a reasonable discussion to have by elected officials who are footing the bill on behalf of the taxpayers for what is about 20%, 26 million out of 126 million of our budget that is taxpayer funded. I will say that that is what we have the Belleville Police Service Board, of which I am a member, of which Mayor Ellis is a member, and we have 3 other members who are appointed either municipally or by the province to overview these budgets and to make sure that we are in line. Councillor Carr referenced, I believe it was Hamilton and London have gone through a similar process for cost per value, and I would note that both of those services are significantly larger than ours, and neither one of them is in our comparator group, which contains municipalities such as Cornwall, North Bay, Cobourg, and many others that are similar size to us, of which we are very competitive with, and none of them are undertaking a similar process to my knowledge. The other thing I would mention is there was discussion about innovation and creativity as well. And that is really an area where I think that Belleville is not only leading, but leading far beyond our means in terms of what we're producing. We've seen through our body-worn camera program, our new automatic reporting taser program, the dash cam footage, drone usage in different situations, which has been very helpful, particularly in hostage situations and some others. And as well as integration of technology into police vehicles, where you used to see officers riding around with sort of a laptop beside them, and they're having to deal with the laptop while they're on the road. We've been successful at integrating handheld phones that are hands-free in the vehicles, which saves a significant amount of space, eases the responsibility to calls, and this is something that we've actually had calls from the Chicago Police Department as well as the LA Police Department about how we're integrating that technology into our vehicles, and we're viewed regionally as, in fact, an innovation center, and we're starting to see that that is bearing fruit in terms of us getting advanced use of technological programs because of the way that we've adopted them and adapted them into our service and into our vehicles. So we not only are doing very well in terms of our comparator group, in terms of the amount of money they spend based on their population and the number of officers they have, but we're actually excelling in the innovation and creativity department, even with the budget we have, which is comparable to forces that are not doing that. So from that perspective, I want to assure everybody that I believe that your funds are being very well spent and managed. We have a budget committee as part of the Police Service Board that analyzes all of the budgets line by line and makes sure that everything that is entering that budget is mission critical. I would also point out to people that the vast majority of the costs associated with running a police service are salaries, most of which are mandated, all of which are negotiated, and our comparators are assessed and addressed relative to the salary increases that our officers are receiving, and where we can't get to an agreement is arbitrated by people familiar with that space based on our comparator group. So there's nothing that's occurring from a salary perspective, which is the vast majority of that budget, that is not in line with our comparator group. From there, I want to discuss this idea about hiring a consultant. And I think that the point is well taken by Mr. Ferguson, that this is not something that's within the scope of city staff to do, and something that should be done by an outside third-party agency if it were to occur. But the challenge that I have with this, and I'm sure that some of my colleagues around the table may have experienced this at times as well, is that often these outside consultants, whether it's these large firms, you all know the acronyms, this, that, and the other thing, and similar firms, the challenge is that they do all sorts of these programs for all sorts of different municipalities. And sometimes what we end up with is a very cookie cutter, non-tailored solution that we spend a lot of money on. We're talking about between $125,000 and $225,000 for a solution that maybe isn't made in Belleville, maybe doesn't reflect the needs of our community, and is certainly going to affect our bottom line and increase that budget or the city's budget. But as Councillor Thompson always points out, there's only one taxpayer, so you will be paying for what may not be a very specific assessment of the needs and the services that are required by the Belleville Police Service. So from that perspective, I am opposed to this, not because I think it's an unreasonable question to ask, are we getting good value for money, but because we already have mechanisms in place, such as the Belleville Police Service Board, to do that. And often when we do reach out to these outside firms, we don't actually get something that properly assesses and addresses our needs, and we've seen that whether it's organizational reviews, we've seen that with some of the pushback recently in terms of transit, all throughout the organization where we've hired these large consultants, we do not always get our money's worth from them, and it does not always end in a positive result, not only for this council, but for staff, as well as the community. And so I'll be opposing it on that basis.
Any other discussion on this? Mayor Ellis.
Thank you, Councillor Alsop. And I guess, Tyler, I know the answer, I guess, to this basically, or Councillor Alsop. What is the ratio of employees? 90% of the budget? 95% of the budget?
Closer to 95%.
95% of the budget. The last time new police officers were hired was 2015. So let's roll back, that's 9 years. What's our population has grown in 9 years? Are we one of the fastest growing communities in Canada? I think we say that a lot around this table. So we've had an increase, the Belleville sign's gone up, what, 7,000 or 8,000 people? Crime and calls were, I think, up 18% last year, up 18% the year before. So if you go back to 2015 and you go move forward, call volume is up over 50%. And we haven't hired a single officer in 2015. The first officers that were hired were last year by this council, or by the police board, pardon me, and approved by this council were 4. I've been out on calls, and they've had 6 officers on duty on a Friday night covering the whole city. 6. They go to Thurlow. How much is Thurlow expanded? A lot. And so we're looking at doing, spending upwards to maybe $250,000, and we're gonna hand that to the police board, and guess what the police board can do? They don't have to accept it. They don't have to look at it. We're going down a road here that when we look at our comparables, and the police board has done the budget, looked at Cornwall, looked at North Bay, we're right in the same amount. So I am frustrated in the sense of, last police board I asked the chief, why didn't you hire officers? Because they wouldn't let us. They wouldn't let us. You guys have been in retail, some of you have your own businesses. If your business is up 50%, are you gonna hire people? Do you have to hire people? We have done technology, we have cut that back at the board. We're, as Councillor Alsop says, we've got a great police community. Then guess what? We built a new police station. We doubled the size of it. Would electricity bills be up? Would cost of that be up? Yeah. So I am not gonna support this in the sense because I'm afraid that what's gonna happen is it's gonna go up and we're gonna need more officers. I think we're going a slippery slope on this one. Thank you.
Councillor Millet.
Thank you, Chair, and I'm also going to vote against this. I think the last thing we need right now, and I fully support Councillor Carr's frustrations and share a lot of his concerns about the lack of information we're getting, but since considering two things, we're entering a search for a new chief and a deputy. This, while it doesn't implicitly include a call for policing service from the OPP, and I've been around here long enough, and Councillor Thompson's probably recalls the last exercise of when the notion of considering OPP was in this chamber. It's a wrenching exercise. By inference, my worry is that this, and while we're taking pains here to say that this is in no way an invitation or an opening of the door for the OPP, it's implicit in the kind of the message that you're sending is that somewhere there's waste at that place. We just spent tens of millions of dollars on a new police station. We have, as the mayor pointed out, increasing calls for service. I tend to listen to the chair of the Police Services Board when he says they paid very good, close attention to comparative forces. The last thing I think the public wants to see us spending our money on right now is another consulting firm at almost $250,000. That we honestly, we just don't need to make another consultant group of accountants and pencil pushers coming in and looking under every blotter for a way to save money on the backs of our police force. So I'm just can't support it today.
Thank you, Councillor Kelly.
Thank you. Through you, Chair, I appreciate Councillor Carr bringing the conversation piece tonight to Council. We've referenced, the Mayor did, Cornwall and North Bay, and I think Councillor Alsop did. Over the weekend, I looked at what they're doing in their municipalities, and just a little bit of homework for you. Cornwall, 49,000 people. Their yearly budget for police service is $22 million. They have 93 officers, 12 special constables, and 37 civilians make up their community. North Bay, population 51,000. Their budget is $26 million, and they have 102 officers and 62 civilians. Similar to what we have here in Belleville. Belleville's 26 million. We have a combined staff, that's officers and civilians, special constables in around 175. I think I was trying to get those stats, but that's where that's at. Yeah, just to touch on what Councillor Alsop and Councillor Millet had to say, now's maybe not the time for this. I see our Belleville Police Service out and about, building relationships, strong presence in our community, and it's been tough the last several years for our police service, and I'm here to support the service, and I think they need that right now too, instead of this up in the air. And but I can appreciate where you're coming from, Councillor Carr, with the calls to service and getting a review, but I can't support it, and I'll stick to my guns on that. Thanks.
Any other discussion? Councillor Wright Miller.
Thank you, Chair. I just want to weigh in too, probably not as eloquently as my other councillors, but the information just shared here about this topic is pretty compelling. I don't know. I think a third-party company called in to do an assessment will come up with something because they're being paid. So something will come up, and as Mayor Ellis said, it might be the wrong thing for us. I don't think right now we should be spending our taxpayers' money on an assessment like that when we have, if there's an issue with the costing for the police, I think we go back with the Police Services Board, talk about it. We can do it amongst ourselves right now. So I don't think I can support it either. I can't see the costing for this, this report. Right now, as you said, what's going on with the police services and hiring a new chief, and it's probably not the best time. So, thank you. I won't support.
If I could, I just want to make sure everybody's had an opportunity. So, Councillor Thompson, could I ask you to take the chair so I can offer some comments?
Councillor Brown.
Thank you. I know we've had lots of discussion about what this particular motion is. I just wanted to refer back to the report itself that talks about the purpose and the reason for this. When we invite different organizations, kindred agencies that are funded through taxpayer rate assessment, we allow them to come to the podium to talk about what it is that they're requesting in their budget. And often they will offer us their KPIs, their levels of performance, other performance indicators that are made available so that when we look at the cost, we have some semblance of being able to determine that we're getting good value for the money. Regrettably, I've experienced 2 police budgets now, and not to say that they aren't appropriate, but we're not in a position to talk about KPIs, performance indicators, return on what it is that we're investing in, whether or not that the investment is actually resulting in a reduction or addressing the services. So I just wanted to remind us all and remind me about what the purpose of this study is, and it's not about OPP costing. It's about cost effectiveness of operations compared to other municipalities. If that information is available and has been completed by the Police Services Board, then the question becomes, do we need a consultant to do it, or can we just provide that information? Service quality in turn, including response time in all tax areas, crime prevention measures, and community engagement efforts. All of that information probably is available to our police service, and I suspect that it would be going to our Police Services Board. So again, you don't need a consultant to pull that information if it's already available. Resource allocation, including efficient use of resources, scale of procurement, and operating and capital expenditures. I think that it may be a fairly straightforward conversation with the Budget Committee that serves on the Police Services Board. And again, it isn't necessarily a consultant. A consultant might have the time available versus our staff to pull this information in. But if in fact it's as readily available as been suggested through debate tonight, then I think it would be just as easy to be able to provide it to us so that we can do that assessment. And finally, performance indicators such as crime rates, clearance rates, and citizen satisfaction. KPIs has been a topic of discussion for a number of years around City Council and with our staff. There's a significant piece of work that we are all being asked as councillors to respond to from our city clerk about key performance indicators, things that we would add, things that we would remove. So I don't believe that it is an ill-timed question to be asking the same from our police services without a reflection of whether it's good, bad, or indifferent, but in fact, can we measure it to determine whether or not we are getting value for the money that we are spending. This is not a reflection at all, by any means, on our police services. I don't believe it's a reflection on past senior officers or incoming senior officers. But to be perfectly honest, if I was an incoming police chief, God forbid, but if I was an incoming police chief, then it makes perfect sense to me that I would have a lot of information and made available to me so that I could assess whether or not I would like to make changes in our operation. So with that said, I would just like to state that I will be supporting the motion. Thank you, Councillor Thompson.
You're welcome.
don't think that that's an unreasonable thing to ask. So this is the agenda for Thursday, follow with me. This is the publicly available agenda. This is all available to anybody who has any interest in looking at it, including members of the public. Board information matters, item 11I. Item A, 2023 year-end financial report. Item B, 2024 first quarter financial report. Item C, 2025 capital and operation budget timelines. Item B is a good story about body-worn cameras, not relevant to our discussion. Item E, downtown policing office. Item F, police service first quarter downtown foot patrol report, so you can see how many officers were downtown, how long they were there. First quarter report, complaints against police, holding ourselves accountable. First quarter report, school response officer. First quarter report, drug intelligence street crime unit. First quarter report, traffic safety unit. First quarter report, emergency response unit, court statistics, community response unit, crime statistics, calls for service stats, and the update on our first quarter in-trust report. So a lot of that information is publicly available and is part of every one of our agenda packages. And should there be a need for additional information, we would be happy to provide that in the package. And if that's what's being asked here today, to produce this in a more formal version or something that's a little bit longer term, that's certainly something that is doable. Does not require a consultant, does not require $250,000, does not require a motion, just, it's all there for you, and if there's anything additionally, we'll get for it.
Thank you.
And I apologize, I did not have my microphone on for that entire time, so the public will not get it, and it will look very strange on video.
Would you like to go again?
Is there time? I don't think there's time.
Thank you. Councillor Carr is the mover. If I could ask your final comments, and then if I could ask you to read the motion again in its entirety, so we all know what we're voting on.
Yeah, I'll start with that. So to receive it and that this matter be referred to the 2025 operating budget as a budget issue for council's consideration with a funding source of taxation, which would include the city undertaking such a review by engaging an independent consultant, and council submit a formal request to the Belleville Police Service Board for consent for participation in the review. I'll provide a copy to the clerk so he has the accurate wording for the record. Unfortunately, Councillor Alsop's microphone was off, and so that didn't get captured appropriately, I guess. I'm not going to paraphrase what he said, and I don't want to take it out of context, but I think it's fair to say that he pointed all of us to the Police Service Board agenda and data and information that can be provided. I appreciate that. That probably would have been a lot more useful at budget than a body cam footage, because that's not demonstrating results. Again, this is about referring a matter to budget, and yes, there is a cost associated with it. You know, it'll be interesting to see come budget time, as I see directors be on the way there, that you know, look, we're not going to scrutinize too hard here on the policing. So it'll be interesting to see how much scrutiny comes down the road on other budgets. The fact of the matter, and I don't want to repeat myself, but we are separate from the police. It was suggested here that we are hiring a police chief. We are not hiring a police chief. The Police Service Board is, and that's how the law reads. To say otherwise confuses public and assumes that we're into things that we're not. And so we're not hiring anybody. The Police Service Board has to undertake those things, no different than Quinte Conservation may hire a CAO and will be asked to fund a portion of that salary. So I think that is important to clarify. There's always the comparables of Cornwall, North Bay, and others, and we have the same setup, if you will. The question is it value for money there? Has anybody bothered to ask? Or as the one article I referred to is, you put the same inputs in, you get the same outputs time and time again. And so is that occurring? I recognize that police are sacred, and that you know, it's a matter of let's not go too far down the scrutiny highway, if you will. I recognize that the Police Service Board has oversight, but who is the Police Service Board accountable to? The province maybe, but not us. They'll come to us with a budget, and we have to decide whether we're going to take the bulk figure and we're going to give them that money or we're not. There's provincial appointees, a lot of provincial appointees, they're patronage appointments from the government. We see that. And I don't know anybody that's on the board other than the two appointees from council. And I don't want to go down that road, but the reality is that it's okay for us to ask this question. I'm not going to belabor it. I can do math in my head and I can count to 8, so I know where it's going to land. But that's the intent behind it. No different than I would scrutinize an internal budget and request performance indicators to say what results are you delivering to the taxpayer that's funding your bill. You know, and again, what I hope to see, and the Police Service Board chair is here, is ways and means that resources are being utilized to actually see a reduction in police service. There are police jurisdictions in Ontario where they have officers that go out to repeated areas for repeated calls for service to say what is the real problem here and what other resources can we provide other than having 2 constables show up at 11 o'clock at night every Friday night for the last 6 months. And so those things will start reducing your calls for service. So in hope that perhaps the hiring doesn't have to increase to the same degree, which then keeps the budget in check. And at the end of the day, as it's famously said around this table many times, there's only one taxpayer. And when I'm doing the math already based on hiring projections for next year, a pre-budget approval, we're looking in the neighborhood of about a 4% tax increase before we've even asked the directors sitting here today to provide their budgets for next year. And it's that macro level of affordability is the reason for the request here today. Thank you.
If I could call for the recorded vote.
Councillor Brown,
Yes.
Councillor Carr,
Yes.
Councillor Enright Miller,
No.
Councillor Kelly,
No.
Councillor Millet,
No.
Councillor Thompson,
Yes.
Councillor Alsop,
No.
Mayor Ellis.
No.
Motion fails.
Madam Chair, your microphone's not activated.
Thank you. It's sort of like Zoom. Unmute. Council may adopt consent items by one motion, but prior to consideration of such motion, members may request that specific items be removed from consideration under such motion, and council shall consider such items individually. Starting with my right this time, Councillor Kelly.
Through you, Chair, 8C2A.
8C2A. Councilman Millet.
8C2C.
Mayor Ellis.
Don't have any, thanks.
Councillor Alsop.
No additional?
Councillor Mike Miller.
8C2B.
Councillor Carr.
I'm going to speak to 8C2A, please.
Okay. And Councillor Thompson.
And both have been pulled A and B for me.
So, that the council, that the agenda items be received with the exception of items 8C2A, 8C2B, and 8C2C. Could I have a mover, please? Thank you, Councillor Alsop, Councillor Enright Miller. All in favor? Thank you. Then returning to item 8C2A, resolution from the town of Lincoln urging the provincial government to support increasing funding to both public libraries and community museums, recognizing these institutions as national assets and strategically investing in their potential to renewing post-pandemic social cohesion, economic well-being, and community resilience. Mover, please. Thank you, Councillor Kelly. Councillor Carr. Anyone wishing to speak to the item? Thank you, Councillor Kelly.
Thank you. Through you, Chair, just hoping we'll get the support tonight with the letter from the town of Lincoln. Councillor Brown is the chair of the Glanmore Committee, and Director Dean is on that committee as well, and it was just at the last meeting, the staff at the museum, and we were talking about government funding being so pathetic. So this is good, a letter is being sent to the province, so that's why I brought it up, and we'll get the support tonight. Thank you.
Councillor Thompson.
Yeah, I would like to speak on this. I don't sit on the committee for the library anymore, but for a number of years I sat in that committee, and am I correct? I think it's still $87,000. $84,000 that the province provides to the library. That hasn't increased in 400 years, I don't think. Seems like 400 years, but it's a long time. And it's disgraceful that libraries, as important as they are to communities, for students, for children, for adults, that there's no extra funding provided, not only for the library, the museums and everything else. So I'm speaking in favor, especially for the library, which I was fortunate to chair for a number, and Councillor Carr does now. Thank you.
Thank you. Councillor Carr?
Thank you, Madam Chair, and not to belabor it, but yes, $84,357 has been the provincial allocation to the Belleville Public Library since the mid-1990s. That works out, according to the Bank of Canada inflation calculator in today's dollars, of $154,590. So we're not even keeping up with the rate of inflation. And I don't want to speak too long on it, but you know, we appreciate the funding that the City of Belleville provides in a grant, just over $2 million. A very small portion of the external agency budget or boards and committees. But the library service is an area where anybody, regardless of income, has access to. And we have eliminated late fees for books and resources. We also have hotspots now that we can give out for folks who don't have the ability to connect to the internet in a time when connectivity should be as easy as the road in front of your house for access to things. And so, you know, we're not asking for a lot, but it would be nice even if the province would keep us up to inflation. Thank you.
Any other discussion on this item? Seeing none, all in favor? Thank you, the motion's carried. 8C2B, resolution from the County of Prince Edward strongly encouraging action by the provincial government to urgently create a municipal accessibility fund for municipalities to develop, implement, and enforce AODA standards related to goods, services, accommodation, employment, and buildings modeled after the Canadian Community Building Fund or Ontario Cannabis Legislation Implementation Fund on a per-household basis, and to commit to work with the municipalities to implement the Donovan Review immediate crisis recommendations. A mover, please. Councillor Enright Miller, a seconder. Thank you, Councillor Alsop. Discussion? Councillor Enright Miller.
Thank you, Madam Chair. I'd just like to endorse this letter provided by the County of Prince Edward as accessibility chair, and just pull out some highlights from the letter for the viewing public. And just the AODA legislation has been created to help people with disabilities fully participate in society, in the workplace, and as a consumer. The legislation has been implemented to enforce these standards, and we cannot get to these standards without help. As this letter has pointed out, we have 2.9 million Ontarios currently who live with a disability, representing about 22% of the consumer base in the workforce. And due to barriers, those with disabilities are often falling short of their full potential. Compliance with AODA is supposed to be in effect for January 1st, 2025, and this will not be achieved. Municipalities need help with funding to remove accessibility barriers. So I would like us to support this letter to push the province to set up a municipal accessibility fund. Thank you.
Councillor Thompson?
Yeah, I appreciate Councillor Enright Miller pulling this. I happen to be chair of the Accessibility Committee. When they brought in this AODA regulations a number of years ago, and I remember being at the AMO conference in Ottawa, and I stood up and asked the minister of the that looked after this particular portfolio for funding, and they said, there is no funding for your standards. We just want you to make sure that your municipality is AODA regulated, with no intentions of funding it back then. They got no intention in funding it now. We need to be strapped, we are strapped with making the regulations standard in the City of Belleville, and we should be. These standards that they provided for us were great standards, but they provided no funding, and they even admitted at AMO that there would not be any funding for this in the future unless it changed. So hopefully this will rattle their chain again and say, maybe we can get some funding out. So thank you.
Any other discussion on this item? Seeing none, all in favor? Thank you, the motion is carried. Moving on to 8C2C, resolution from the municipality of West Perth in response to the Ministry of Natural Resources and Forestry's proposal, regulation detailing new minister's permit and review powers under the Conservation Authorities Act. Recommending to the province that proposed changes contemplated by the province be put on hold until such time that the planning statement is finalized by the province and communicated to the municipalities. A mover, please. Thank you, Councillor Millet. Councillor Alsop. A discussion, Councillor Millet.
Thank you, and I'll be brief. I would ask that we support the municipality of West Perth in petitioning the government. As we've seen in the last year and a half almost, the province has almost with glee put the boots to the province's conservation authorities, and I can't tell you the amount of disarray and dismay that was voiced for some of these changes at the recent annual general meeting of associations of conservation authorities of Ontario. Just to put it into context, what this legislation under the proposed summary of this that is coming into effect, the comment period is April 5th to May 6th. And it closed April 5th. It was May 6th. And they basically wanted to put it on hold until the provincial policy statement could come into place. The permits that are issued by the minister, this is in essence an MZO that we've heard an awful lot about. It just simply takes away the approval or the ability of conservation authorities to issue permits where they're applicable and where they should be applied near water courses and sensitive areas, wetlands preservations, that sort of thing. And in the zeal for this, build faster, whatever, they're taking the authority out of conservation authorities, pardon the pun, and the minister will be issuing the permit. So if a proponent wishes to petition the minister to issue an order, the proponent can simply bypass, do not pass go, do not collect $200, bypass the conservation authority on whose expertise and staff should and rightly be commenting on this, go directly to the minister and say, yep, there you go, here's your permit. You can build wherever you like. Now, I'm sure that's overstating it, but it says here that the minister must, when making his decisions, include whether the activity is likely to affect the control of flooding, erosion, dynamic beaches, or unstable soil or bedrock, and it also must consider where the activity is likely to create conditions, etc. This is lip service in the legislation. The minister has no such, picture it. This is a ministry that all of a sudden is going to take on all of the functions of conservation authorities of this province? No, they're not. They're going to rubber stamp that application saying, Buddy here wants to build 18 homes along the banks of the Moira River up at the source. We think it looks good. Bingo, way you go. But we'll get them built fast, bypassing the conservation authority. This is an outrage. It should be parked, and good on the municipality of West Perth for bringing this forward, and I hope we all support it. Thank you.
Any other discussion on this item? Seeing none, all in favor? Thank you, I just had to count hands there. Item 8D, thank you, thanks Gordon. I feel better now. Item 8D, rise and report. Could I have a mover and a seconder? Thank you, Councillor Carr, Councillor Enright Miller, all in favor? Thank you.
Thank you, Councillor Brown. First reading of bylaws, bylaw 2024, 107, 108, 109, 110, 111, 112, and 113. Moved by Councillor Alsop, seconded by Councillor Thompson. All in favor? Carried. Second reading of bylaw and discussion, 2024, 107, 108, 109, 110, 111, 112, and 113. Moved by Councillor Enright Miller, Councillor Carr. Discussion? All in favor? Carried. Third and final reading of bylaw 107, 108, 109, 110, 111, 112, and 113. Moved by Councillor Alsop, seconded by Councillor Carr. All in favor? Carried. Next, we have new business. Anybody? Councillor Enright Miller?
Thank you, Your Worship. I just have a little announcement. On behalf of Councillor Kelly and our Accessibility Committee, I would like to let Council and the public know an exciting event that we're hosting this month. National Accessibility Week begins May 26. This is an opportunity to recognize and celebrate the contributions of Canadians with disabilities, as well as promote accessibility and inclusion in all aspects of life. In celebration, we're hosting a fireside chat here at City Hall on May 28th, starting at 1 p.m. till 3:30 p.m. The Assistant Deputy Minister of the Ministry of Seniors with Accessibility, Manu Sikand, will be attending this event to speak to us and share educational insight about accessibility. Manu has spent most of her life showing others that although people with disabilities can work hard and contribute to society, working hard isn't enough to change society's attitudes about disability. She is also the founder and CEO of Accessibility for All, a nonprofit organization that helps organizations make their practices accessible, with a particular focus on youth, women, and people from racially marginalized communities. She currently sits on the board of the Canadian Women's Foundation of Race and Disability Canada. She has volunteered with numerous organizations, including the Centre for Independent Living and ARC, a disability law centre. A sought-after speaker, she was inducted into the Canadian Disability Hall of Fame in 2020. We're very fortunate to have her join us for this event to help our community strive to bring awareness. We will share not only our Accessibility Committee's successes thus far, but our ongoing priorities in helping to make our city more accessible through ongoing educational forums and awareness to this community. I just have to share one of the quotes that I really like that she has said. We all have some abilities, and to the best of our abilities, we should be able to contribute in the world that we live. The system should be set up in such a way to enable you, not disable you. This kind of sums up her work. So we would invite any of you who would like to attend this event, just please register ahead, but you are all more than welcome. Thank you.
Millett?
Thank you, Your Worship, and we all heard with great interest, and I commend my fellow councillors for the great remarks and the listening with not just with our ears but our hearts to these doctors who, and I think it was best put when it was said, why do you put up with it? Because they're passionate about their patients, and they out of a sense of, I believe, Dr. Whalen, simply out of a sense of altruism. And you don't hear that from many professions anymore. I believe it from these people. And I've got two, I'm going to ask for a motion here for a resolution, and then I'm going to ask for a report from staff. But first off, whereas the province of Ontario is responsible for providing quality health care to all residents of Ontario, and whereas family medicine is the backbone of the healthcare system and providing timely access to a primary health care provider for everyone in the province is essential and should be the provincial government's highest priority, and whereas the shortage of family physicians across the province has reached a crisis point where millions of Ontario residents do not have a family doctor, and hospitals, emergency rooms, and clinics are overloaded by the healthcare needs of Ontario residents. And whereas studies have shown that without access to a primary care provider, patients end up with poorer health outcomes, and it costs the healthcare system more. And whereas the province of Ontario could address this issue quickly and efficiently by increasing the wages paid to family physicians and lessening the administrative burden all family doctors face when managing their practices, therefore be it resolved that the province of Ontario take immediate action to ensure family physicians are properly compensated with immediate fee increases, and that the administrative burden now being experienced by family doctors be reduced so they have more time to see their patients. And further, that the City Clerk forward Council's resolutions resulting from Council's approval of these recommendations to Premier Doug Ford, Health Minister Sylvia Jones, MPP Todd Smith, MPP Rick Barize, the Association of Municipalities, and to the Municipal Clerks of Ontario's municipalities.
I need a seconder for that. Councillor Enright Miller. Discussion?
Thank you, Mayor Ellis. The only thing that I would add with that resolution, and we should consider, is actually request a response back from our MPPs. Because I can guarantee you that it will be, here's your nice resolution, thank you very much, signed by an office administrator, and get filed in file 13 through the shredder, and on it goes. That's if we're lucky. Based on what the doctors told us, we met by silence. The reality is we need action, but we need the accountability that comes with the action. So I would suggest that we ask for a response.
Through you, your worship, I'm happy to add that at the end, and that council request a direct response from our members.
Could you add a timeline on that? I know the one we sent them in February, we haven't, or November, we haven't still got that one back.
Well, maybe if we keep embarrassing the buggers, they might pay attention anyway. 30 days, within 30 days. Yeah, we'll add that to the bottom. Thank you.
All in favor? Carried. Councillor Carr? Oh, Councillor Millet, sorry, you got a second one.
Yeah.
And again, I'm not going to belabor what we heard in the passionate pleas from our doctors. And I understand that this isn't our purview. We shouldn't be having to do this. But the simple fact of the matter is, as Dr. Whalen said, the province simply isn't listening. Our own members aren't listening. Our own MPP, Minister Todd Smith, has been ignoring people right, left, and center on this matter, like with deafening silence. It's preposterous. So I'm going to ask for a report from staff at the next possible meeting of council, and including the involvement of the CAO, finance and physician recruitment personnel, to consider recommendations that made by today's extensive and detailed breakdown of the challenges and struggles being faced by our valued community of family physicians. Simple
thank you.
report on what may or may not be feasible. Thank you.
Councillor Brown? Oh, do we have to vote on the staff report? I don't believe we do. Okay. Councillor Carr?
Thank you. I have two items for new business. One is related to the connection charge bylaw. There was an motion that came forward and was passed by council, but there's an amendment that my colleagues have now that it's been reviewed by the city solicitor. So there's just a section added in there that the owner of a pre-existing construction residence shall have an indeterminate period of time from the date of the notice to pay the connection charge, provided that they will be subject to the connection charge then in effect at the time of payment, and that when notice from the city is provided, the homeowner can, and this is another amendment, opt for these exemptions provided they complete a waiver to the satisfaction of the city. And I understand that, so I'll put that amendment on the floor.
Seconded by Councillor Brown.
And I understand if the amendment motion is approved for council's consideration, I would ask that the corresponding bylaw be prepared for the May 27th council meeting. Thank you.
Discussion on the amendment. Councillor Ossoff?
Yes, thank you, Chair, and I just want to thank my colleague, Councillor Carr, for bringing this forward. I know this was something that I received a lot of calls about, and we would typically think of this as being more of a rural issue with the amount of expansion that's happening in those neighborhoods. There's a lot of areas inside of urban Belleville where this was an issue. I know that certainly when I was door knocking on Montego Boulevard, they were screaming to have access to city services. But when I was talking to people on Bridge Street West, they were saying the opposite. We just replaced our well, we just spent a significant amount of money. To feel that we have to connect is going to be a massive burden on our family and something that we'll have to take out a second mortgage for. And so I think that the great thing about this motion is that it gives people the opportunity to do it at a time when it's convenient for them and when it's feasible for them and their families. And I think this would be a big win if we could get this approved for a lot of people.
Okay, all in favor of the amendment? Carry. Vote on the original amendment. All in favor of the original, Councillor, all in favor, seconded, whatever, done, carried, okay. I thought.
Thank you, Mayor. I have one last under new business. I have a motion here that Mayor and Council support the Belleville Senators' bid for pre-competition games and/or camp for the 2025 IIHF World Junior Championships hosted in Ottawa in December 2024 and January 2025, and that council provide the Belleville Senators with a letter of support to be included in their bid package. I have some comments.
Moved by Councillor Carr, seconded by Councillor Millet. Discussion? Councillor Carr?
Thank you, Mayor Ellis. The Belleville Senators, in partnership with the Bay of Quinte Regional Marketing Board, are preparing a bid for the pre-competition games and/or a camp for the 2025 IIHF World Junior Championships hosted in Ottawa in December 2024 and January 2025. For many who are hockey fans, it's a rite of passage to watch the World Juniors starting on Boxing Day. The Ottawa Senators are supportive of this bid and look forward to help with planning and facilitation of the events. The games or camp would be held in Belleville at the Quinte Sports and Wellness Center and predominantly CA Arena, all subject to building availability, potentially from December 18th to the 24th, with delegations arriving as early as December 12th. This will include a large volume of hotel bookings, venue bookings, tourism promotions, catering, and restaurant usage, which will bring significant visitors to the Bay of Quinte region. Hockey Canada provides a large volume of hospitality for incoming federations, which will result in an economic boost for the hospitality industry in this region. The Belleville Senators will carry all costs of production, venue and ticket sales, with shared revenue to the Regional Marketing Board and Hockey Canada, and there is no financial commitment needed from the city or its stakeholders at this time or in the foreseeable future. So hopefully we can support that.
All in favor? Carried. Anybody with any more motions? I have one myself, and this is good news again, thanks to our manager of doctor recruitment. I'm asking for a bylaw, the bylaw number 2024-116, a bylaw to approve and authorize the execution of a medical service agreement between the Corporation of the City of Belleville and Dr. Sayad, to be read a first, second, and third time and finally passed on this 13th day of May 24th. Moved by Councillor Brown, seconded by Councillor Enright Miller. Discussion, all in favor? Carried. Great work. Announcements. Councillor Millet.
Thank you, Your Worship, and I have a couple on Saturday at your behest, and representing council, myself and Councillor Kelly teamed up to take the morning and the afternoon shift respectively for the regional finals for the spelling bee of Inter-Rotary. So this was an effort that's annually by the Rotary Clubs of Belleville, Brighton, Campbellford, Cobourg, Quinte, Sunrise, Sterling, Trenton, and Wellington. And a great group of kids, and it's nice to see that spelling and correct grammar are still have a place in our education system. These kids, if they're any indication, are a great example for the future. Winning the morning junior section that I brought greetings to and participated in was Shrinan Naik of Cobourg, Burnham Public School, but there were probably 24 participants, and it was a fantastic group. We had great representation from Belleville schools, and congratulations to Shrinan. And there was some tough words, and some I struggled with myself. So Councillor Kelly, I know, was there for the afternoon, and he's got the winner, I believe, of one. But I just wanted to say as well, myself and several people in the chambers today, Your Worship, Mayor Ellis, Clerk Matt McDonald, Councillor Catherine Brown, myself, and others returned, well, it seems like a couple of weeks ago now, from our twin city of Gunpo, Korea, and it was a fabulous trip. As always, they certainly do roll out the welcome mat for us. And you know, Gunpo, as we know, is a city of almost 264,000 people. And in scope and scale compared to Belleville at what we were at, it's quite something. But it's just a beautiful city. The people really value our relationship. We toured the area quite a bit. We were special guests. I don't know if anybody can see, but this hillside we pride ourselves on some of these parks. This is something to behold. This is almost 220,000 azalea trees, and they're all in bloom up a mountainside right now. And we hoofed it mostly up the hill, Your Worship. I think we got pretty well 2/3 of the way up. But among the other things we did as well as touring these facilities, we visited an energy from waste facility, which was quite an eye-opener for us. And we actually have a PowerPoint presentation on that, some video from inside the facility. Interesting to learn that they're much more common there than if you propose to build an energy from waste. There's one, I believe, in Durham region right now, but it's almost as if you're planning to put a nuclear reactor in your backyard if you want to have one here. There, it's a matter of course. They insist their stack emissions are next to zero or as close to infinitesimal as you can get. That I'd like to see a little closer study on, but it was an interesting exercise. But again, we want to thank Simon and Cindy Kang for being our ambassadors. They did a spectacular job of getting us there and back. And the food, of course, Garney, you would have loved it had you gone back. But anyway, again, great trip to our sister city in Gunpo. And we can't wait to welcome them back in a few years hence. Thank you.
Councillor Kelly.
Thank you. I'll be short through you, Chair. The mayor and I on Saturday had a chance to walk in the Huntington's disease walk. Huntington's disease, genetic disorder, passed from parents to kids, 50% chance of passing the gene as well. Last year they had 3 people that walked in it. Sandra and Paul Huffman and Judy Harding. And this year the Belleville firefighters showed up after their morning shift to support their colleague Peter Huffman. His wife Brenda's going through some challenges right now with Huntington's disease. The mayor and I walked it. There was close to $110,000 raised, so well done. I was at the Inner Rotary Club Spelling Bee working in pinch hitting for the mayor. Violet Dickey of St. Gregory's in Picton was the winner. 23 schools, and I think 50 students were involved in that. And a couple weeks ago, I had a chance to be at the Quinte Boccia event happening at the Quinte Sports and Wellness Center. This is a Paralympic sport. 40 athletes participated from across the province, from Oshawa, Toronto, Ottawa, Pickering. I spoke to the president, I believe, of Bocce Paralympic League from Ottawa, and she said the Belleville facility at the Quinte Sports and Wellness Center, second to none. The way they get treated, thanks to Director Dean and all the team there, they love coming to Belleville. They come into town, they stay overnight. It's a weekend away. Colleen DeMills made a big difference in the boccia for our community. Last year, 5 were participating. This past winter, 12. As of today, every Thursday, 20 athletes show up weekly at the Quinte Sports and Wellness Center. Talk about being an inclusive city. This is another example. Aurora Whalen, amazing athlete, grade 7 student at St. Joe's here in Belleville, was killing it all weekend on the court. So great job. Thank you.
Anybody else? Councillor Thompson? Oh, sorry, Councillor Brown, I didn't see your hand up.
Thank you. This weekend on Saturday, I had the privilege of attending Seventh-day Adventist Church out on Dundas Street West. The purpose of the event was civic appreciation that the church is doing for the very first time. And they were acknowledging the Belleville Police Services and showing their appreciation. The keynote speaker was Mansfield Edwards, who is currently the 20-year chaplain for the York Regional Police Service. And his wife, Mrs. Edwards, and I unfortunately didn't get her first name, is the longtime chaplain for the Toronto Police Service. So very much a committed family in terms of what it is that they observe as in their chaplaincy. I was joined there, of course, by Acting Chief Chris Berry, and I'm going to apologize, our chaplain, Ben Beal, thank you. Brad Beal, thank you. I had the Brad part, I couldn't remember the last name, so I apologize to Brad. It was actually a day-long event. Acting Chief Barry and Chaplain Beal and I were there for about 2.5 hours. It was a lovely day, and fortunately the rain held off until our part of the day was done. But I wanted to express my thanks to all of the church members. Quite interesting to hear when someone comes to the podium, it's hello church. And so to be able to look at the congregation and to be a part of that on Saturday was very fulfilling. And I made a commitment that I would return on a less formal occasion so that I could experience it. So thank you for asking me to attend as Deputy Mayor.
Thank you, Gordon. Councillor Thompson.
Yeah, thank you, and I'm sorry I missed the Korean food there, Councillor Moret, but I'm sure it was enjoyable, and I'm glad you went. I just happened to come back from Ireland and a great trip, and Councillor Kelly just asked me, did you meet any Kellys over there? Well, I got a bit of an issue here. I just happened to have a Mr. Sean Kelly come up over to, and he's running for politics over there. So I thought I'd check with our clerk. Is it illegal to run here and run over in Ireland at the same time, Mr. Clerk?
Certainly is.
Well, I'd like you to present with this Mr. Kelly's election campaign poster. So I would like to put him under notice that he's breaking the law. So we had a great chat. A much better personality than our councillor, but it was fun. I just happened to pick this up and I thought it was inappropriate here. So Councillor Kelly, thank you.
Okay, anybody else? We have 15 proclamations, so you're gonna have to bear with me, and I'm not kidding you. There are several proclamations at this time of year for important causes in our area. As the mayor of the city of Belleville, I would like to proclaim the month of May as Community Living Month, Food Allergy Awareness Month, Huntington Disease Awareness Month, Jewish Heritage Month, Lyme Disease Awareness Month, Museum Month, Sexual Assault Awareness Month, Skin Cancer and Melanoma Awareness Month, and then I would like to also proclaim May 10th as Lupus Awareness Day, May 12th as Multiple Chemical Sensitivity Awareness Day. I could read all the proclamations. I'm just going to do it this way. Is that okay? Then I don't have to read page by page. May 13th is Felon Dafa Day. May 18th is Porphyria Awareness Day. May 21st to 27th is National Public Works Week. And Director Reed, Public Works Day, or week. You got any celebrations there?
We're going to have a barbecue with staff on the Friday.
And Garney cooking? And finally, May 26th is Red Shirt Day to mark the start of National Accessibility Week. So we got through them. Next, we need a confirmatory bylaw, that bylaw 2024-114, a bylaw to confirm the proceedings of council at its meeting held on May 13th, 2024, be read a first, second, third time, and finally pass this 13th day of May 24. Moved by Councillor Alstott, second by Councillor Millette. All in favor, carried. Motion to adjourn, Councillor Brown and Councillor Thompson. All in favor, carried. Thanks, everyone.